guys? Welcome. This is the AlMansoori Know Your Body training. So this is a very important training. It's mandatory for all employees. It's going to run about 3 to 4 hours. And in this training, you'll find out about how the body works and why you should take care of it and how to take care of it. At the end of this training, you will have a test. So you guys must pass this test. If you do not pass the test, guess what happens? You have to retake the course. Okay, so please pay attention to what we're saying. Questions on the test will be answered by everything that I'm saying. Or you can also read along. You have a booklet, the Know Your Body booklet, okay? You can read along in the booklet. All the answers on the test are going to be in this booklet. Okay? I'm Dr. Robin. I'm the Chief Wellness Officer for AlMansoori. I'm in the corporate HSEQ. I'm one of the doctors who's looking over your medicals and putting you into a category and then talking to you about your health. So, like we said, you're going to have to take a test about everything we talk about today. So, let me ask you guys, where do you get most of your health information?
Hospitals.
From the hospital? From who at the hospital?
Ask for the consultant or the doctor.
So you get your information about what to eat from your doctors?
Yes.
Okay, where else do you get information about what to eat?
From the doctors.
Just from the doctor?
Yeah.
That's it?
And from Dr. Robin.
Well, I'm a doctor, okay. But where else do you get your information on where to eat?
Sometimes from the papers, booklets.
From other people?
Booklets.
From booklets?
Booklets, yes, book.
Okay, how about from the TV? Does anybody get information from the TV? Okay, so let me ask you this question. So most of your health information and information on what to eat comes from your doctors, right? Okay, which are usually medical doctors. We call them MDs. So how much nutrition has your doctor taken in school? Does anybody know how much nutrition the doctor learns in school? Nobody knows? Usually, most medical doctors get 0 courses in nutrition. Right? 0. You know this number? Okay. But yet you listen to him about what to eat. Right? So how does your doctor know what you should be eating? If he doesn't get it when he goes to school, he doesn't get that information. So where does he learn that? They're getting the information from the same place that we get it. Besides, they're getting it from other people and the TV. Does everybody understand that? So these doctors are not studying nutrition. They're getting what they hear on the TV. Has anybody heard the commercials that say you must drink milk to get strong bones?
Yes.
Yes. So the doctor hears that. So then he tells you, you must drink milk to get strong bones, right? Okay. So should we believe him? No, we shouldn't believe him, right? He doesn't learn it in school, but yet he's the one telling you what you should be eating and what you shouldn't eat, because this is what he's heard. He doesn't really know. So what I'm trying to tell you guys is you need to be wary of what you hear from other doctors, because most of them have no training in nutrition. I've been studying nutrition for over 10 years. So I'm going to tell you a lot of things today that may go against what you've always been taught. Okay? But I'm asking you, you don't even have to listen to what I say. Question it, and then go study on your own and you find out who's correct. Okay? Because you're going to hear a lot of things like, it's okay to eat eggs. Eggs are actually very healthy. Eggs with the yellow inside. Okay? You're going to hear things that go against what you've been taught. But the reason is, I've been studying nutrition for a long time. Okay? So what I'm teaching you is stuff that I've learned from studying nutrition. So you can listen to me, or you can listen to your doctor who has no training in nutrition. Right? Everybody with me? Yes. Okay. So when we're talking about the human body, they say the body is very similar to a machine. Do you guys know what a machine is? well, my definition of a machine is something that has input and you get output. Okay, so name me some machines. Car. A car. What else?
Injection pump, water pump.
A water pump. What else? What's another machine? A washing machine. We put clothes in, we put dirty clothes in, we get out clean clothes. What else? What? Power generator. What else? How about a cell phone? Computer. Exactly. Great. Okay, so you guys understand what a machine is. Okay, so let's take the example of, what's your name?
Tarek.
Tarek gave us the example of the car. Everybody know what a car is? Yes. Okay, what is the input that you need in a car to make the car run? Fuel. What else?
Oil.
Oil. What else? Water, right? So you have to put these things in the car. What if I have decided that the petrol is too expensive? So instead of putting petrol into the petrol tank, I am now going to put sand. Because sand is free here in the UAE, right? There's sand everywhere. So I'm going to put sand into the gas tank. What do you think is going to happen? It won't work. Why will it not work? Why won't it work? It's not the correct input for the car. Does everybody understand that? If you put sand into the gas tank, the car is not going to run. It's not the correct input. Is everybody with me? You understand? Okay, great. Wonderful. So we said we're going to compare the body to a car, right? So now let's take the body. What is the correct input that we must put into the body? Food. Food is number one, okay? Number two, water. Water, we must have water in the body. If we do not have any water in the body is going to break down. Okay, and then what's the last one? Air, oxygen. We need lots of oxygen. So say I take a pillow and I put the pillow over Tarek's face and cut off his oxygen. What's going to happen to Tarek? He's going to die, okay? If we don't give him food or water, he's going to eventually die also. All right, we must have this input. And what is the output that we get? Energy. We get energy for movement and to do to do things. So this is very important. So what is the correct kind of food? What kind of food should we be putting into people? Vegetables. Food that's full of nutrition, right? Vegetables are full of vitamins and minerals. So it's got potassium, magnesium, sodium, niacin, vitamins, vitamin A, vitamin B12, folate. Okay, we need all these vitamins and minerals. We get all of this from our vegetables. Okay, so now what's your name? Safe. Safe. Okay, so say Safe has decided not to eat any vegetables. He's only going to eat Kentucky Fried Chicken every day and drink lots of Pepsi. What do you think is going to happen to Safe?
It's like a cell and engine. Same.
The same as the engine. Yeah. He's going to break down because
no vitamins.
No vitamins and minerals in there, right? It doesn't have the proper nutrition that the body needs. It's junk food. Okay, everybody know what junk food is? If he eats nothing but junk food, he's going to break down. His body is not meant to run on junk food. That's why we call it junk, right? This stuff is not good for the body. We need to be getting our vitamins and minerals. The meat does have vitamins and minerals in it. So you do get nutrition from the meat. However, it's cooked badly. When it's fried, when it's deep fried like that, you make it, it gets really bad. So we need to have the correct food, okay? Now, we also need clean water, okay? How much water are you supposed to drink in one day? Well, we say about 2 liters, okay? We say about 2 liters of water, give or take.
It's depend of the weight.
It does depend on the weight. I tell everybody the goal is about 2 liters. You drinking 1.5 liters, you're still doing pretty good. During the summer, when it gets really, really hot and humid, you need to increase your water. Okay? Now, back to the vegetables. For vegetables, the body requires every day 5 to 9 servings of vegetables every day to get the proper nutrition it needs. How many of you are eating 1 serving of vegetables a day? Hand up. That's it? 1 serving. Wow, that's pretty bad. How many of you, so how many out of those 10 people that raised their hand are eating 5 to 9 servings a day? None of you. Wow. What do you think happens when you're not getting the proper requirement? Your body's going to break down. This is why so many people have diseases. Do you know somebody who has diabetes? Raise your hand. Every single person should be raising their hand. Do you know somebody who has cancer? Do you know somebody who's had a heart attack? Raise your hand. Because we've been eating a lot of bad foods and getting a lot of chemicals in the body, and the body is breaking down, and this is a huge problem. This is one of the reasons nobody's getting the requirements of vegetables every single day. We need 5 to 9 servings, not every week, every day. Okay? You will see this again. Okay. So, and then we also said 2 liters of water, and we also need clean air, right? Oxygen, clean air. What happens if Tariq spends the whole day smoking cigarettes? How much oxygen do you think he's getting? Very little. Very little, right? So this is what we need to understand. When you're doing things like this, putting in the bad input, eating bad foods, putting in smoke and air pollution all the time, and not drinking any water, your body cannot take this. Okay? In medicine, when we're talking about the body, okay, we break the body down into 4 different layers, okay? So the smallest layer that we can break the body down into is called a cell. You see the word at the top? Yes. A cell. Has anybody heard of a cell? Yeah, okay, good. So the cell is just like the body. What do we say about the body? It requires input in order to get output. Okay, so this is the word cell, yeah? Everybody with me? So the cell, it's just like the body in that it needs input and we get output. So remember we said what would happen if we put the pillow over Tariq's face? He will die. Okay? So what do you think will happen if we cut the oxygen off to the cell? The cell will die. So this is an example of the cells, okay? So up here, these are blood cells, okay? You cannot see the cells with the eye. You must have a microscope in order to see them, okay? They're that small. You must have a microscope. You guys know what a microscope is? You guys back there? Yes? No. Yes? Okay, you must have a microscope, otherwise you cannot see the cells. But this is how a lot of them look. So we have skin cells, we have muscle cells, we have blood cells, okay? All right, so the thing about the cell, this is very important to understand about the cell. This is a drawing. This outer wall here, we call the cell membrane. Okay? You don't have to remember that, but this outer wall. This outer wall is made up of fat. It's very greasy, yeah? Greasy, it's like oily. Oil, fat, greasy. The reason why is because of what I told you. It needs input and output. So the outer membrane of the cell is made up of fat, so things can move in and out very easily. You understand that? Okay. What if this was made up of concrete? Nothing will go in and out of the cell. Okay? If this was made of concrete, nothing could go in and out. None of your cells would be able to live. You would not live.
Even the body is breathing.
Even the body is breathing, yes. It needs the oxygen to come in. If this is made of concrete, oxygen cannot go in, right? So keep this in mind because we're going to talk about how this relates to disease a little bit later on. But remember this part. We need to have this made up of fat. How many of you have been told you should not eat any fat in your diet? You've heard that? You should not eat any fat in the diet. Have you guys heard this? You guys have heard it? You should not eat any fat, right? Okay, if you don't eat any fat, where are you going to get the fat to make this part of the cell from? From rice? This is the problem, guys. This is what I was telling you about bad information. People telling you not to eat fat. This is very bad information. You must eat fat. Everybody repeat after me. I must eat fat. However, you want to make sure you're eating good fat, not bad fat, okay? You must eat fat though every day. If you don't eat fat, you're constantly making these cells. You're making new cells every day. If you don't eat fat, you cannot make these new cells, okay? You've got to have fat to make these things. Okay, so repeat after me again. I must eat fat. I must eat fat, but I want to eat good fat. Good fat. And we'll talk about good fats and bad fats in just a few minutes. Okay, so, yeah, and this is what I was talking about, the cell membrane being made up of fat, so things can move in and out of the cell. Okay? And we're keep that in mind because we'll see how this plays into some diseases later on. Okay, guys, so we talked about cells, right? So, now, if you take a group of cells, you're going to get what's called a tissue. So a group of blood cells is blood tissue. A group of muscle cells is muscle tissue. Okay, a group of skin cells is skin tissue. Okay, now you take a group of tissues, you're going to get a organ, right? You're going to get an organ. Name me some organs. Heart, kidney, liver, lungs, eyes, ears. Wonderful. So these are all organs, okay? And an organ is a group of tissues. Okay, now if we take a group of organs, we're going to have an organ system. These organs work together to form a system, okay? Now, name me some organ systems. Nervous system, respiratory system, reproductive system. Yes, these are all the systems, okay? We're going to take the rest of this course to go through each system one by one. We will be skipping the last three. The integumentary system, the reproductive system, and the endocrine system. So I'll just give you a brief thing about each one. Okay, so integumentary system. This is all about the skin. What's the skin for? Protection. The skin is for protection. What is it protecting us from? From the heat. From the heat? From the dust. Okay. What else? What's all over everything? What's all over everything?
For this, for feeding something?
Sorry? What's all over everything? Everything you're touching. What's all over everything? Germs, bacteria, virus, right? So if you see the skin, if the skin is touching bacteria and virus, can it get in? No, it cannot get in. Only bacteria and virus can get in from your like mouth, nose, eyes, your orifices, right? But it cannot get through your skin. Now, if I take a knife and I cut Tarek's arm, and now I cut his skin open, now the bacteria and virus can get in. Does everybody understand that? Yeah, now it can get in, now it's open. That's why we put a Band-Aid, right? You put a bandage to cover your wounds, right? Because you want to keep all the bacteria and the virus out of there. Okay, so that's the integumentary system. Okay, the reproductive system. This is about having babies. This is way too complicated for us, so we're going to skip this one. Okay? All right. He wants to know about having babies. Okay, the last one is the endocrine system. Endocrine is about hormones. You know, anybody know what a hormone is? Yes. Okay, what's a hormone? You can name one. Testosterone. All the men know about testosterone, yeah? And the women, they have estrogen, right? So that's also very, very complicated. We're not going to talk about this one, okay? All right, so is everybody with me? Okay, so now we're going to move on to the nervous system. Okay, I want everybody to look at this. N-E-R. Ner. And sometimes you'll see it as N-E-U-R. That means it's in the nervous system. Okay? Because in medical language, they like to take the first prefix and then add other letters onto the end of it to make words. So I'm not going to expect you to remember all these big long words, but if you know that N-E-R or N-E-U-R is in the nervous system, you're good. You at least have that clue, right? You say, okay, I know this is in the nervous system. Got it? Yes. Okay, wonderful. So the nervous system, this is what it looks like. Okay? So it's going to include the central nervous system with the brain and the spinal cord. And then it's going to include all the nerves coming off of the spinal cord that go to the rest of the body. See? You got nerves coming off that go all the way down to the foot and the arm. It's also going to include the senses. What are the senses?
Eyes, ears,
Eyes.
skin.
Exactly. There you go. So, the senses, all right? Tasting, touching, seeing, hearing. This is all included in the nervous system, okay? The brain is the CEO of the body. He tells the body what to do. So everything's got to go through the brain, yeah? Okay, so he controls language. He controls movement, okay? He even controls emotion and feeling, which is kind of weird, right? Where do you guys, when you guys think of love, where do you think love comes from? Really? You say, oh, I'm so in love. The heart. Here, you say the heart. Here, you say, I'm so in love, right? Or you say, I love you. You hold your heart. Because we feel like our emotion is coming from the heart, okay? It's not. It's actually coming from the brain. So if I want to make Safe fall in love with me, all I have to do is, while he's looking at me, I stimulate his brain to release a hormone. And I can make him fall in love with me like that. Okay? So this is all, your emotion comes from here. What about fear? Where do you feel like fear is? Where do we feel fear? Brain. No. We don't say, I'm so scared. Who says that? From your eyes? Well, usually, especially if you think of little kids when they get really scared, it's usually here, right? It's usually we feel it in the stomach. Or when you get up and it's very high, your stomach drops, right? You usually feel the fear here, but it's actually coming from the brain. Okay, so that's the brain. He's controlling everything. Now, look at this word. Neuron. N-E-U-R. What does that mean? It's in the nervous system. Right, correct. So the neuron is the cell of the nervous system. Okay? This is a picture of it. You see this? This is our neuron. He's the cell of the nervous system. What do we say about the cells? It needs input and it gives output. Okay. He looks a little bit different from the other ones we looked at, right? From the other cells I showed you, the other cells were kind of round with the nucleus. This guy, he's got all these branches, okay? The reason why he has the branches is because he needs to transmit messages very quickly, right? So, say I want to move my foot. I want to move my foot. My brain has to tell my foot to move. Look how quick that was, right? That was really quick. How did the message get there so quick? Because of these guys, because of the neuron. They have all these branches so they can send the message really quickly. Okay? And then they're covered in all of this. What do you think this is made of? Fat. Good job. Somebody's thinking. This is made up of mostly fat, right? What do we say about fat? The fat allows the input and output to go through the cell, right? So this guy, your brain is 60% fat. So, do we want to eat fat? Yes. Yes. If somebody tells you you should not eat fat, tell them you're wrong. You don't know anything, right? If your doctor tells you you shouldn't eat fat, you need to eat good fats. Exactly. Okay, so that's the neuron. Okay, now, the neuron, he communicates with other neurons with the neurotransmitters. You don't have to remember this long word. What do you have to remember? N-E-U-R. It means it's in the nervous system. Okay, so the neurotransmitter is, it's a chemical messenger. It allows the neuron to communicate with the next neuron. So this is one neuron and this is the other neuron. So the chemical messenger, the neurotransmitter, goes from one to the other with the message. And this is how we're able to, our brain is able to do things so quickly. Okay? All right, everybody with me? Okay, now let's go back to the brain. The brain is very, very fragile, right? So one of the things we have for protection is this, the skull. Okay, because if we didn't have the skull, if we didn't have a skull and I went up to Safe and I punched him in the head, what would happen? Yeah, he would have severe brain damage. He would probably die. Okay, this is why we don't go around punching people in the head, right? Okay, so the first protection is the skull. The next protective layer we have is called the blood-brain barrier. The blood-brain barrier. This is a barrier that goes around the brain. And what it does is it keeps stuff out. Okay? So, let me ask you this question. What happens when you get a cold? How do you get a cold? Where does that come from? When you get a cold or flu, what does that come from?
From the nose.
Okay, no, but what is it that's giving us the cold and flu? What is it that's making us sick? The virus, right? We get a virus. So you get a virus, the virus comes into the body, and it makes you sick. If you did not have this blood-brain barrier, that virus would go straight to the brain, and it would kill you. Okay? But because we have this barrier, the virus, most viruses and bacteria cannot get across. They cannot cross, so most viruses and bacteria do not make us sick. Everybody understand that? However, there are some that cross. There are a few that get across, and if they get across, you get a brain infection. Is this good or bad? This is very bad, guys. Brain infection is very bad. Okay, so this barrier protects us it keeps most things out. However, there are some things that can still cross. Okay, what still crosses? Well, heavy metals. You guys know heavy metals? Okay, like aluminum, mercury, lead. These things cross the barrier, right? How many have been told you don't play with mercury? Right? Mercury? How many of you will play with mercury? You play with mercury? Mercury. You play with mercury? No. Why not? Because it goes to your brain and it kills you. How many of you play with H2S? Y'all play with H2S? Shame on you. This is why we don't go around H2S, right? H2S goes and crosses that barrier. It infects your brain. And what happens within 2 seconds? You're dead. Okay? This is why you need to understand these things are poisonous. They're going to come in the body and kill you. This is why we don't play with aluminum and mercury and lead, especially in the gaseous forms, right? How many of you have mercury fillings in the mouth?
All of us.
All of you? Okay. This is very bad, guys. Very bad. Every time you chewing, you're hitting your tooth, it's causing gas. Where do you think that's going? Straight to your brain. Please do not get any more mercury fillings. And if you have one, take it out. Because you're getting mercury gas every time you're hitting your teeth. And how many times do you chew a day? 1 million, right? We're constantly chewing. So this is a problem. And please do not put these mercury fillings in your children. How many of you have children? Okay, almost all of you. How many of you have put mercury fillings in your children? Okay, we need to stop doing that. This is very bad for them, okay? Sorry?
I'm going to move it for him tomorrow.
Okay. Okay, now, what else crosses the blood-brain barrier? This aspartame. Who's heard of aspartame? No one? How many of you think you have this every day? No one. Of course not, it's poisonous. Okay, how many of you drink diet soda? Diet soda? Diet Coke? Diet Pepsi? Sometimes?
Sometimes, yeah.
Pepsi Light? Light 7-Up? Okay, guess what's in there? Aspartame. How many of you chew gum? Who chews gum? Ah. Did you know that? Guess what's in there? Aspartame.
This morning I chew one.
You chew gum this morning? Oh God, your brain is going to be damaged.
This morning I just...
Aspartame is in a lot of products. Anything that is diet or light or sugar-free. Aspartame is a sugar substitute. Everybody started getting very fat. So then they said, what can we put in our food that tastes sweet but will not make us fat? So they thought, oh, they made this aspartame. They started putting it in everything. How do you know if something you're eating has aspartame in it? How do you know? Okay, say you're gonna get some gum. How do you know if the gum has aspartame in it?
We read.
You read the label. Read the label. The label says ingredients, and it will say aspartame. Okay? This is how we know, because you don't want to be eating this stuff, right? Let me tell you a story, true story. My mother drinks, she grew up drinking 6 Diet Coke every day. 6 Diet Coke every day. Okay? So she went to the eye doctor. She went to the eye doctor. And the eye doctor told her, you have a cataracts. You know what cataracts is? Okay. The eye doctor told her, you have a cataracts. You must have surgery to remove it. What system did we say the eye was in? What system is the eye in? Nervous system. Remember we talked about the senses, right? The senses, the eye is in the nervous system. So she had read that drinking Diet Coke causes cataracts. So she quit drinking Diet Coke. 6 months. She went 6 months. She went back to the eye doctor. Guess what the eye doctor told her? You have no cataracts. You have been misdiagnosed. There is no cataracts. All right, this is great, right? So what do you think she did after that? She started drinking Diet Coke again. Yes. And then 6 months later, she went back to the eye doctor. Guess what happened? She had surgery for cataracts. I want you guys to understand, we are poisoning ourselves. The worst part is she knew, she knows. If I drink Diet Coke, I'm going to get cataracts. And look what happened. Okay? But this is what you guys need to understand. When you're poisoning yourself like this, you have only yourself to blame. I am here to educate you on what you should and should not be eating and drinking and doing, right? But you have to make the choice. I cannot come to your house and put a gun to your head and tell you you cannot drink Diet Coke. You have to make that choice on your own, okay? So, from here on out, if you choose to drink Diet Coke, whose fault is it? It's your fault. You know now, right? You know.
It's about the Diet Coke only or about anything?
Anything diet, anything sugar-free.
The gum and the...
Gum, there's candies, there's chips, there's all kinds of sugar-free stuff full of aspartame. But how do you know if it's in there? You read the label. You take the, you say you bought a bag of chips or crisps. You turn it over and read the ingredients. If it says aspartame, guess what? There's aspartame in there.
So what about the tablets of the sugar-free?
Sugar-free.
Small...
Oh, like the Splenda and the, yeah.
Splenda like this.
Yeah, yeah. No, we don't want it. That's not aspartame, it's different, but it's very similar, it has a lot of problems. So you don't, even the little sugar-free packets, you know, like the Splenda and the Equal, the blue and the yellow ones, do not use those. It's got aspartame and other stuff in there that you don't want to be using. Okay?
What about the yogurt?
What about yogurts?
Yes, diet yogurt.
Okay, diet yogurt. Do you think that will have aspartame in it? Probably. How do we know? Read the label. Read the label. I can't tell you if it's in there or not. You need to read the label.
So if I need something sugar, if I need some sugar test, how I can eat the sugar? How I can eat the sugar with the tea?
Okay, well, first of all, you shouldn't be eating a lot of sugar because a lot of sugar is what's causing a lot of problems. We're eating way too much sugar. But if you're going to eat sugar, it should be in the form of like honey, date sugar, coconut sugar, these natural sugars. But you shouldn't be eating it very often. Okay, we need to calm down. This is why AlMansoori has a policy, no sugar. Why? We eating too much sugar. We eat so much sugar, we're giving ourselves sugar problems with diabetes. Okay? Sugar is causing a lot of problems. Back in the day, they only ate sugar once or twice a week. We eating sugar every day and we're eating tons of it. Okay? So, what I tell people, get used to not having sugar. I used to drink sugar in my tea and coffee all the time. I quit. The first week it was weird because you're like, this tastes yucky. And now, if you put sugar in my coffee or my tea, I can't drink it. It's too sweet. Okay? There is one substitute that you can get. It's called Stevia. Everybody can see that one? It's called Stevia. Stevia is it's actually a plant. It's a plant that it tastes like it's sweet. It's really not. So it doesn't, it's very natural. So if you're going to use any substitute, use Stevia. And they sell this at Lulu. They sell this at Organic Food and Cafe, Waitrose, Spinneys. You can find it there. Okay? But I tell you, just get used to not having sugar at all. That's the best thing for you.
What about with some honey?
A little bit of honey is okay. But you need to be very careful. You don't want to be eating a gallon of honey a day. Okay? But yeah, I would prefer you put a little bit of honey rather than sugar in your tea. Now the next one is called MSG, or we call it monosodium glutamate. Who's heard of this one? One person. This is also known as Ajinomoto. Ajinomoto. Yes, everybody knows this one. How many of you cook with Ajinomoto? Oh, a lot of you. Okay. Ajinomoto. Ajinomoto is it's something you use to cook with. It enhances the flavor. It's a flavor enhancer. So you put it on some meat, it makes it taste really good. Right? That's why y'all use it. Makes your food taste good. Right. Okay. So, the problem with this, it's crossing the blood-brain barrier. It's going to your brain. Is this good or bad? This is bad, okay? So, the problem with MSG, and also it overstimulates your taste buds. It overstimulates your cells, and it causes them to the point that they die. Okay? So people like it because it makes their food taste good. But this is how companies trick you. Okay? Has anybody eaten Doritos? Doritos? Okay. Does Doritos taste good? Yes. Why do they taste good? A lot of MSG in there, a lot of monosodium glutamate. Because really, if you ate Doritos without the MSG, you would do like this. That tastes yucky. So this is how food companies trick you. They sell more product. Why? They put MSG on it, and you keep buying it and eating it because you think it tastes good. Yeah, right? This is their trick. So you need to watch a lot of these junk foods full of this. How do we know if this is in your food? Read the label. If you go buy yogurt, read the label, see if there's MSG in it. If you go buy bread, chips, candy, anything, read the label, see if there's MSG in it. Okay? Because do you want to be eating this? No. No. We don't want to be eating this, okay? Okay, so who's going to go home and throw it in the garbage? All right, good job, guys. If not, you might as well, look, I'll put some MSG on this booklet and you can eat this for lunch. Yeah? No? You don't want to eat it? Come on, it's good for you. No, it's not. But that's what you're doing when you buy food full of MSG. It's not really food. It's stuff full of chemicals, and they're filling it with MSG to make you think it tastes good. They're trying to trick you. Okay? Okay, so what about tobacco? Any smokers in here? Yes, you don't have to raise your hand. Okay, so smokers, the tobacco is going straight to your brain. Okay, also alcohol, beer, wine, it goes to the brain. This is why you have a couple and you're like, ugh, that you can't walk, right? Or you try to talk, blah, 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 you end up talking like that. Okay, because this stuff is going to the brain. Okay, so now, going back to the brain, you see all these little arteries, these little blood vessels? These are bringing blood to the cells of the brain, okay? We said every cell needs input and have output. So that's why we have a blood supply to all the cells. Now, what happens is a lot of times in the brain, you'll get one of these will get blocked. And we call that a stroke. Because when it gets blocked, the blood cannot flow to the cells and cannot bring oxygen. If no oxygen can get to the cells, what happens? The cells will die. And if you have a little one, say you have a little artery that gets blocked, you have a little stroke, you still live. But if you have a big one, say you have a really big one that gets blocked, and you have a huge part of your brain that doesn't get oxygen and it dies, guess what happens to you? You are going to die. Okay, guys? So, there's a few ways you can get there's different kind of strokes, but the one I'm talking about, what do you think it is? What is it that comes in and blocks the artery? Cholesterol. It's cholesterol. How many of you have heard of cholesterol? Okay, cholesterol, right? Cholesterol is, we get worried when our cholesterol is too high. This is why. High cholesterol. Because if the cholesterol is too high, it will go in there and it will block it and it will cause a stroke, right? Okay, so what is it that causes high cholesterol? Say again? Bad fats. Bad fats, exactly. That's one thing that causes high cholesterol, bad fats. Cholesterol actually comes from the liver. You know your liver? Your liver on this side, here's the liver. This is your liver, right, guys? This is your liver on this side. So your liver's here. Okay, so the liver makes cholesterol usually in response to inflammation in the body. And we're going to talk about inflammation in a little bit. But it's a response of the liver. Cholesterol does not come from your food. How many of you have heard, don't eat eggs, don't eat nuts, don't eat avocado, it's full of cholesterol, right? This is not good advice. This is very bad advice. We do not absorb a lot of cholesterol from the food, so that's not where it's coming from. It's coming from the liver. The liver's making it, when we're not very healthy and we have too much inflammation in the body, the liver starts making a lot of cholesterol. So, what causes inflammation in the body? Bad fats. Okay? So let me ask you, what are the bad fats? What's a bad fat? White bread, that's not a bad fat.
Rice,
Chicken skin, not really. What's a bad fat? No, not rice. Junk food has bad fats in it.
and oil.
Do you know, not all oil though. All oil is fat. Some of them are good, some of them are bad. Deep fried processed oils. Okay? So how many of you have eaten at Kentucky Fried Chicken? Ah, yeah, okay. And they deep fry the chicken. They coat it in flour, and then they throw it in a fryer full of bad oil, okay? And then they fry it, and then you eat it. This is very bad fat, okay? So bad fats include corn oil. How many of you have used corn oil? Corn oil, mazola, sunflower. Sunflower is not a good oil. Canola oil. How many of you use canola? Shortening, vegetable shortening. Yeah, this is very bad for us. Okay, these highly processed oils are very bad. What's a good oil? Olive oil. Olive oil is very good. Coconut oil. Coconut oil is very good for us. Okay, what about butter? Butter? Butter is a good fat. Butter is a good fat. How many of you heard it's bad? A lot of you, yeah? Butter is actually a very good fat. Okay? Also, how about ghee? You know ghee? Animal ghee. This is actually a very good fat to use. Animal ghee, butter, coconut oil, olive oil, nuts, avocados. These are all natural oils, that are natural fats that are very good for the body. Okay? We want to get away from those yellow processed oils. Corn oil, canola oil, sunflower oil, mazola, vegetable shortening. All these are very bad for you. They're all highly, highly processed. So, okay, who's heard of trans fat? Trans fat. Anybody heard of trans fat? Raise your hand. Trans fat. We also call it margarine. Margarine. Who's heard of margarine? What is margarine? It's a substitute for butter. It's a substitute for butter. But this is very, very, very bad for you, bad for the body. How many of you are using margarine? A lot of you. Okay. This is this is more bad information. Remember I told you at the beginning there's a lot of bad information going around? This is very bad information. Okay? Why? Margarine is a trans fat. It's a trans fat. We also call it partially hydrogenated oil. It's basically like eating plastic. You know what plastic is? How many of you want to eat plastic? Nobody in their right mind wants to eat plastic, but that's what you're doing when you're eating this stuff. I'll tell you how this got made, okay? When you have fruits and vegetables, right? Real food, and even meat. You put fruits and vegetables, you put meat in the fridge. How long does it last till it rots? 1 week? We'll say 1 week on average. Your fruits, some fruits will take 2 days, some will take longer than a week. Okay, meat, you put meat in the fridge, sometimes that only lasts 3-4 days, right? It rots. So they were trying to send food to places that needed food, like Africa. But if they put the food on a ship and send it to Africa, guess what happens by the time it gets there? It's rotten, right? It rots. So they came up with this trans fat, and what this does is this, you put this in a product and it allows the food to be good for long periods of time. Okay, so we'll talk about, remember we talked about Doritos. You know crisps? Doritos. Let's take a bag of Doritos. We're not going to open it. We'll go get a bag today. We won't open it. And we're going to put the Doritos in the corner, and we're going to leave it there for 6 months. Then we're going to come back in 6 months, and we're going to open it, and we're going to take a bite. Will it taste the same as it would in 6 months as it would today if we opened it? Yes. Yes. Yes, it will. Have any of you ever looked at the date on your bags of crisps? They're usually over 6 months old. Sometimes more than that. Sometimes, you know, they can last for a whole year. Why is that? Why can they last so long? Trans fat, because it's full of this. How many of you agree with me? If we leave a bag of Doritos, say even in 1 month, we'll leave a bag of Doritos, we won't open it. 1 month, we come and we open it and we can still eat it, correct? Yes, right? This stuff, because it's full of this stuff, all right? You see these grocery store aisles? Most of that's full of this stuff, trans fat. We call it partially hydrogenated oil. And let me tell you why. Okay, let me tell you how they make it. So what happens is they take, you know, if you take an oil, like say canola oil, what state is it in at room temperature? What state? It's liquid. It's a liquid, right? Canola oil is liquid, right? All right, so what they did, bomb it with hydrogen. They bomb it with hydrogen. Now what happens? It turns into margarine. Margarine, right? What state is margarine in at room temperature? Solid. It's a solid. You understand? They take a liquid, they turn it into a solid. If you let margarine sit on the counter for an hour, is it going to melt? No, it doesn't melt. It actually doesn't melt. If you heat it, it will melt. But if you leave it at room temperature, it will not melt. Okay? So they've made this, so this partially hydrogenated oil is more stable. It's more stable than the liquid form. So it's not going to be as fluid, right? So they basically kind of turned the oil into plastic. Everybody with me? So when you're eating this stuff, it's doing the same thing it's doing in the food. It's staying around your body and not getting out and causing damage. Okay, guys? So, guess where we also find this stuff? Who eats fast food? Kentucky Fried Chicken, McDonald's. Oh, yeah? So, okay, guess what's in there? Trans fat. Go to the next one. Okay, let's take a look here. Here we have a watermelon. Everybody know this watermelon? All right, after 80 days, it's completely rotted away. Let's take McDonald's. After 180 days, does it look any different? No, why not?
That's from trans fat.
It's full of trans fats. This is disgusting. Who wants to eat that? It's not food. They have tricked you. They have tricked you. They put a bunch of trans fat and MSG in there, and you think it's food. It's tasty. Yeah, it's full of MSG. Okay, guys, let me ask you. Let me tell you. So, do you guys want to go eat this for lunch? Because seriously, if you want to eat it, I can give you for free. You won't even have to pay. I'll put a bunch of MSG, and we'll make this taste really good, and you can have the plastic for lunch. How many of you want to eat plastic? Nobody? Why not? I'll put MSG on it. It will taste. I'll make it very tasty. You still don't want it? Why not? But it tastes good.
It's plastic.
So, if you go to a warehouse that has butter, and vegetables. There's tons of rats. You know rats? The little rat? They're coming in and trying to eat the food, yeah? Okay, but if you go to the warehouse where they make margarine, there's no rats. Why there's no rats? They're smarter than we are. They don't eat this crap, right? The rats are smarter. They go smell, that's plastic with MSG on it. I'm not eating that. And how many of you are smarter than a rat? Do you guys believe me? Yes. You do believe me. Anybody does not believe me? Anybody doesn't believe me? Ah, what do we have here? Ants. And what do you think the ants are eating?
They're good fat.
They're eating the butter. Okay? This is the butter. This is margarine. This is soy margarine. Margarine and soy margarine. Do you believe that the ants are smarter than you? Ah, there's the evidence.
So if we have a good food in our home,
You'll get the ants.
It's really very healthy.
Yes, if you keep margarine in your room, you won't have any ants.
So we have to find ants now.
Okay, but look guys, where all the ants are, they're on the butter. What happened to the one or two that actually came over to the margarine? They're dead. Do you want, which ant do you want to be like? The live ant or the dead ant? It's your choice. So how many of you are going to go today and go eat some Kentucky Fried Chicken for lunch? Nobody? What about Burger King? McDonald's? Now you know. Now you have no excuse. If you keep eating this stuff, whose fault is it? It's your fault. It's not my fault. I'm telling you, don't eat this stuff. It's not food. It's not food. They're faking us out. They're tricking us into making us think it's food, and they're selling it to us, and we're eating it. And it's killing us. Everybody with me? Yes. Okay. All right. So if we want to keep our cholesterol low. What can we do to keep our cholesterol levels low? Exercise. Wonderful. Number one to do for high cholesterol, exercise. The exercise will decrease the cholesterol levels. What else can we do to keep our cholesterol low? Proper diet. What's a proper diet? Vegetables. How many servings do we need every single day? 5 to 9 servings every week or every day? Every day. Okay. What else can we do to keep our cholesterol low?
No smoking, no alcohol.
No smoking and no alcohol, because these are causing inflammation in the body. What else? Drinking lots of water. What else did we just say? Eat good fats. Eat good fats. What are the good fats? Butter, ghee, animal ghee, olive oil, coconut oil, avocados, nuts. Good job, guys. Good job. And what oils are we gonna stay away from? Canola, sunflower, corn oil, shortening, yeah, all that junk. Stay away from it. There's a list in your book. There's a list of these in your book. So now when you go home, how many of you cook with sunflower oil? You go home, you take the sunflower oil and you put it in the garbage.
So how we can fry it? By olive oil?
Okay, so for frying, we do not do deep frying. We do not do any deep frying. We don't do where we don't take chicken and put it in flour and then throw it into a big pan of oil. We don't do that. This is very bad for you. You can do, like take a frying pan, put a little bit of coconut oil or ghee, and then take your chicken and brown the sides, the outsides. That's fine. Or you can bake it. You bake it in the oven. But we do not We do not fry in the deep fryer full of oil. I'm not sure about the air fryers. I haven't seen a lot of good information on them, so I'm not sure how good they are. So you,
It's a heater with air only.
yeah, I don't know. A lot of people are saying they're good, but I haven't seen enough information to show me that it's really is doing a good job. So the jury's still out on that. I don't have an answer for you about the air fryers.
So about the food what we buy from frozen food like this, chicken.
Yeah, but you defrost it, and then you can cook it in a pan, or cook it in the oven.
Always in the oil, not in the
The
food.
problem is the oil. It's not the frozen food. Yeah, even frozen food is fine. If you go to Carrefour and you get the chicken that's roasted, that's okay. It's roasted. That's fine. That's much better than going to KFC and getting it deep fried.
Yeah, okay.
Okay? The problem is the oil you're using, yeah.
What about the microwave?
Microwave. The microwave is not the best way. Definitely do not cook your food in it. Like some people make rice in it. No, 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 no.
Only heat.
You can reheat, but that's not even the best. Like I try to stay away from microwave as much as possible. I try to only use it once or twice a week. Because microwave is not a very good way of heating stuff. You really want to cook it in a pan or in the oven. Okay? But microwave, definitely do not cook. Like some people put their raw vegetables and cook it in the microwave. Don't do that. It is changing the structure of the food. And it's not good for us. Okay? But if you want to reheat a little bit of food, like if you cooked some chicken yesterday and you want to reheat it out of the fridge, that's okay. But try not to use it that often. Okay? Okay, so, go to the next one. Okay, so again, we want to keep our cholesterol levels low. We're going to eat good fats. We're going to avoid the bad fats. And let me tell you this, whenever you eat outside of the house, whenever you go buy food, they usually use bad fats. Why? The bad fats are very cheap. They're very cheap. So most places when you go buy your food, they're putting in bad fats. Okay? And then you also want to avoid low-fat food. Anything low-fat, yogurt that's low-fat, milk low-fat. Avoid all these low-fat foods. Most low-fat foods, they're adding a lot of sugar to. Okay? And also to keep cholesterol levels low, exercise. Okay? Exercise. Okay. Okay, guys, we're going to take a break. Our next system is going to be the circulatory system. What does it mean, circulate? Circulation.
The flow of the blood.
Yes, we're talking about the flow of the blood. Okay, so if you look here, here's a picture of the circulatory system. We've got our heart and all the blood vessels. And the blood vessels go all the way down into the fingers and the toes and all the way to the brain. Okay, so the circulation, this is our transportation system.
Please say about the color between the two colors, red and blue. What is the difference between these two colors?
What is the difference between the two colors, the red and the blue on the picture?
Yes.
Okay. Here is a depiction of the blood vessels. Okay? So when they're doing it like this, when it's red color, it means it has oxygen. When it's blue color, it means there is no oxygen. So like we said, when we put the pillow over Tarek's face, what color is he going to turn? Blue, because he doesn't have any oxygen, right? So that's how you remember, when they put it in a picture like this, the blue color means there's no oxygen. The red is there's oxygen. Yes, it's a transportation system. We need something to bring all the input to the cells and take away the output. Okay, so the blood is going to bring oxygen and nutrients all to the cells, and then it's going to take the waste and go away again. Okay? Next one. Okay, so the heart. We're talking about the heart. Everybody know where the heart is? Right side or left side? Right, I hear right and left. It's usually more on the left side. There are a few people in the world that their body organs are backwards. Okay, but most people, it's mostly on the left side. Okay, so this is the heart. Okay, so the heart is a muscle, right? What happens when we overwork a muscle? Huh? No, what happens when you go to the gym and you overwork a muscle? It gets bigger, right? The muscle gets bigger. Do you think the heart's going to get bigger if we overwork it? Yes, it will. It's a muscle.
Be more strong.
No, if you work it too much, it can get too big. And this is not good. Okay? The heart is a muscle. The heart, it has one function. And its one function is to pump the blood. That's all it does. It just beats. Okay? It pumps the blood. Okay. So because it's pumping, it's going to cause pressure. Okay? It's going to cause a pressure. So the heart is pumping the blood, right? So what's in the blood? What's in the blood? We already talked about a few things in the blood, right? The blood is full of water, right? The blood needs to flow. Should blood be like honey?
No.
No. Right, you know honey is very thick and sticky. Blood should not be like honey. If so, we'll have a lot of problems. Blood needs to flow like water. So it's full of water. It's also full of red blood cells. Okay? The red blood cells, these red blood cells are going to carry oxygen. Okay? So we've got full of red blood cells. It's also, the blood is also full of white blood cells. What are the white blood cells? What are white blood cells? It fights the germs. It fights the germs. And we'll talk more about those in the next section. So these are the three things you need to remember that the blood is full of. It's full of red blood cells, white blood cells, and water. Okay? It's got other stuff in there, like platelets and other stuff in there, but this is the most important. Okay, so the blood, and it's the job of the blood to bring the input to the cell and take away the output. Okay, so like we said, the heart, when it's pumping, it exerts a pressure. And that's the pressure we measure. So, what is normal blood pressure? 120/80, guys. You will see this again. This is very important to remember. Because you need to keep track of your own blood pressure. If your blood pressure is going very high, you need to know that. Okay? Because some people have to take medication to bring it down. There's other things you can do to bring it down, like eating lots of green vegetables. And stop eating junk food and stop smoking. These are things that elevate it, okay? Also, exercise, right? Exercise brings down the blood pressure. Okay? But remember this 120/80 is very important. Okay, so again, here's another picture. You have the blue blood, which we said was No oxygen. So the heart takes the blue blood with no oxygen and sends it to the lungs. In the lungs, it's going to pick up the oxygen. Now you see how it's turning red here. Now it's picked up the oxygen in the lungs, it goes back to the heart. Now the heart pushes it to the rest of the body. And those, when it comes off the heart like that, it's going to be full of pressure. So the heart's going to push that oxygenated blood to all the tissues and all the cells in the toes and the legs and all the cells in the hands and all the cells in the brains, right? In the head, in the brain. And then the tissue is going to take the oxygen. Look, the tissue is going to take the oxygen and nutrients from the blood. Now the blood is blue again, right? It dropped off its oxygen. Now it's got to go back to the heart, to go back to the lungs, and repeat the process all over again. Everybody with me? Yes. That is circulation. The blood goes around and around. It picks up the oxygen and the nutrients. It drops it off at the cells, and it goes back and picks up more oxygen. That's all it does all day. Around and around. All right, everybody with me? Okay, now there's two different blood vessels. We have the red blood vessels that are the arteries. These are the arteries. These are the red ones. These carry the blood with the oxygen. Okay, and because of this, because they're the blood vessels that carry the oxygen, they're going to have high pressure. Okay? Now the other ones, see the red ones, these are the arteries. Now the other ones that come back from the tissue in the toes and in the hands and the head are the veins. The veins are not going to have a lot of oxygen, right? They're not going to have any oxygen because they're coming from the tissue. They're also not going to have any pressure, right? They're coming, the veins coming from the toes. The heart's not down there. There's no pressure, okay? So if you look at the difference, you've got your artery that, this is what the artery looks like, but then this is the difference. Look at the vein. What are these? These are flaps, backflow valves. Why do they have these? No, because you don't want the blood to go backwards. There's no pressure. There's no pressure, right? So if the blood isn't moving, you've got these backflow valves that are going to close so it doesn't go backwards. Okay, so let me ask you guys two questions. Number one. Okay, so when you go to the doctor and the doctor is going to take your blood, is he going in the artery or is he going in the vein?
In the vein. Yeah.
He's going in the vein. Why?
To draw blood in the vein.
Why would he go in the vein and not the artery?
No, not pressure.
There's no pressure. There's no pressure. Has anybody seen Kill Bill? The movie, Kill Bill, where they slice the neck open and it squirts blood all over the wall? Why? That was an artery. If we put a needle into an artery, it will shoot across the room because of the pressure. So we must go into the vein where there's no pressure, okay? Now, second question. If there's no pressure, how does the blood move from the toes back to the heart? What's moving it? The heart is not really moving it because the heart is putting the pressure on the blood going down. But how it cannot put pressure back on the bottom. So how is that the veins coming back up? How is that blood in the veins coming back up? What's moving it? Something has to move it. Anybody have any idea? Sorry, I can't hear you. Anybody? No one? What? Movement. 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 What am I doing right now?
Moving.
I'm moving. The muscles. The muscles are moving the blood back to the heart. You must have muscle movement. It also comes from when we have the movement of the diaphragm is another muscle when we're breathing. When we're breathing, so the movement of the muscles inside is also helping it move back. But you really need to move these muscles, right? What happens when you sit all day long? Do you think you're you're having good circulation?
No.
No. Have you seen the women who have the varicose veins? They have the big veins that are this bulging and blue. Why do they get that?
Because the blood is not...
It's not moving. They're not moving. They're either sitting down all day or they're standing all day in one place. They're not really moving. You guys understand why you need to move every single day. If you don't move, you're not going to have good circulation. Does that make sense?
Yes.
Yes, okay. So, what are we doing today and tomorrow? Exercising, right? And you don't have to do anything big, you just need to move. You just need movement. It can be as simple as walking, okay? But this is very important. We need this for our circulation. Just like we talked about the brain, with the heart, the cells of the heart need to get the oxygen and the nutrients from the blood, right? So, these little blood vessels are feeding the cells of the heart blood. So, what happens if you get a blockage here and no blood can pass? You will get a heart attack. Why? If the blood is blocked and oxygen cannot get to the cells they will die. And you get a heart attack. If you get a small one, if you have a small one that gets blocked, you may still live. But if you have a big one that gets blocked, you could die from that. Okay, guys? So this is what, go to the next one. This is an arterial plaque. You know, like plaque, like if you scratch your teeth and you get that yellow plaque? That's why they call it a plaque, because it's yellowish. What is this again? Okay, yeah, but what is the plaque made of?
Cholesterol.
Cholesterol, right? So we get an arterial plaque. This is in the artery. It gets full of this cholesterol, starts to build up, and eventually it closes off, and then blood cannot flow. Okay? So, again, this is about high cholesterol. How can we keep our cholesterol low? And we just talked about this, so y'all should have all the answers. How do we prevent having a heart attack? Exercise, number one. Exercise will help move that stuff out of the arteries. What else? Eating good fats. What are the good fats? Butter, olive oil, coconut oil, animal ghee, avocado, nuts. Also, one we forgot to mention, fish oil. Omega-3. Who's heard of fish oil? Omega-3. This is a great oil. You don't cook with it. You don't cook with it, okay? It's a good oil you can take in capsule, or you just eat a lot of fish, and you get this oil, and this oil will help decrease your cholesterol levels. Okay, but that's another one. And what are the bad fats we want to avoid? Margarine, trans fat, corn oil, vegetable oil, canola oil, mazola, sunflower. These are all bad oils, trans fats. And what else? What was one other thing that causes high cholesterol?
Smoking.
That can. But in the diet, what do we eat that causes high cholesterol in the diet?
Kentucky.
Sugar. Sugar. That's the other one. High sugar diet causes high cholesterol. Okay? So, now, none of you should have high cholesterol next year. Right?
Okay, we talk about olive oil.
Yes.
And this, okay, now in the supermarket, there's a lot of kind of olive oil. They have
Okay.
the cheap one, I mean, the normal
Yes.
price, and they have, and most of us here, we are normal workers, you know. How shall we know that this olive oil, the cheaper one, that is good or bad?
Okay. So, ooh.
Shall we go through MSG and read the label, or, I mean, what
No,
advice do you give us?
you won't find MSG in the oil, in the olive oil. Olive oil, you want to get extra virgin olive oil. Extra virgin olive oil. You can find extra virgin olive oil. This is a good oil. Okay? Most of the olive oils are pretty good. You're going to get a much better deal with buying olive oil than you will with these other oils. But if you get extra virgin, okay, that's what you look for. You also want to look for a bottle that's darker. If it's a clear bottle and it's got olive oil in it, it will go rancid a lot quicker. So you want to get it in a dark bottle and leave it in underneath the cabinet so it doesn't have a lot of light, because the light can make the olive oil go rancid. Good question. Okay, any other questions about high cholesterol, about heart attacks?
Doc, is it okay to discontinue using maintenance for those people who have high cholesterol?
To discontinue using what?
Maintenance medicine.
Oh, the medicine for high cholesterol. He wants to know if it's okay to discontinue your medication for high cholesterol. There's a lot of stuff going on right now, and things are changing. And before, they were putting everybody on statins. Statins will lower your cholesterol, okay? These are very bad medications, very bad medicines. They cause a lot of problems, especially muscular problems, okay? They give a lot of muscle pain. I like to tell people I prefer people to bring their cholesterol down with diet and exercise. And that way you don't need to get on a statin, okay? Because statins, not only do they cause a lot of problems, they also deplete your CoQ10, which is a very important antioxidant in the body, okay? So if you are on them, you need to come and speak with us so we can help you get your cholesterol down. Because if you have very, very high cholesterol levels, it could be dangerous just taking yourself off the medication. So if you are wanting to bring your levels down naturally and get off medication, please come speak to us and we can help you get there. But I wouldn't just get off the medication itself right away without come and get our guidance. Okay?
So what about the diet tea or green tea? It's good for...
Green tea is excellent. Excellent. Diet tea?
There's a diet tea.
No diet tea. Why? What does diet tea have in it? Probably. It's probably going to have aspartame in it.
They write diet.
Yeah. Don't buy anything low fat and nothing diet. Yuck. Okay? Okay, but green tea is excellent for you. Okay, any other questions? What? Okay, he's asking if we can cook with olive oil. What I tell people, olive oil can turn rancid if you put it on really high heat. So olive oil is better room temperature. If you want to put it in a little pan and saute some garlic and some onions on low heat, this is good. Okay, but you don't want to cook meat on high heat with olive oil. If you're going to cook, you want to use animal ghee. Animal ghee or coconut oil. These are the best oils to cook on high heat. Butter and olive oil only use on low heat. Okay? Good? Okay, yeah. So meat is okay for you. It's okay to eat meat. Meat actually has quite a bit of nutrition in it. Quite a bit of nutrition that we need. Okay? Everybody thinks meat is really bad, but same thing with the eggs. Everybody thinks meat raises your cholesterol. That's not true. Okay? There are good meats and there's bad meats. Okay? So, good meat is meat that's raised in its natural environment, and like if you go to some of the farms here, there's a good meat. Okay, bad meat is when people they're making these farms with all these animals on it and they're overcrowding them. And so because they're overcrowded, they put like 100 chickens in a little tiny space like this. And because they're overcrowded, they're spreading their germs. So they're pumping these chickens full of antibiotics. Antibiotic kills the germs. Okay, it kills the bacteria. So they don't get sick.
So the chickens which are available in the markets and all are using these hormones?
A lot of them are. The chicken, and so not only they're pumping them full of antibiotics, they're also pumping them full of hormones to make them bigger. So when you're getting a chicken that has spent its whole life with this much space and full of hormones and full of antibiotics, this is very unhealthy for you. This is very bad meat. Okay? So you need to get chickens that are being raised naturally. They're being allowed to run around and being fed, not being fed corn and all this other junk. Okay? So when you go to the market, you want to look for like organic chicken, free-range chicken. You don't want a lot of the chicken, they do sell some chicken that's full of hormones and full of antibiotics. Where especially do you always get this kind of meat? What places serve this kind of meat? No, not the farm. What places serve this kind of meat? Supermarkets have good stuff too, but where do you go? You will 100% eat this kind of meat.
Organic foods?
No, not organic. I'm talking about the bad meat.
Bad meat.
Who serves bad meat? McDonald's, KFC, all the fast food restaurants. Because this meat is very cheap, they're going to be serving this at all these fast food places, okay? So this is another reason why we don't want to eat at KFC or McDonald's or Burger King.
How about this roasted food? They are also injected with the hormones?
Which ones?
Roasted foods? Roasted chickens.
Oh, the frozen ones.
Yeah.
How would we know? We have to read the label.
Okay.
You have to read the label. If it says organic, if it says free range, these are saying that these chickens are good, healthy chickens. Okay? But if you buy a chicken that's like this big, you're like, oh, you know he's full of hormones and full of antibiotics, right? But yeah, you need to read the label. The label will tell you without antibiotics, without hormones. Okay? And this is a problem because a lot of places use this kind of stuff. So there are farms out in Abu Dhabi that sell chickens that are raised properly. So there's like Yas Farms. There's another one that just opened, I forget the name of it, in Al Rahaba or whatever. There's quite a few farms that have chickens that run around. You're going to pay a little bit more for them, but these are healthier chickens. Fish, most fish is pretty good. If you're getting farmed fish, bad. Farmed fish is terrible. Same thing, they're putting them in a small pen. They're not letting the fish actually go.
Also, we give bad food.
And they're giving it bad food. So you want wild caught fish, okay? Sea fish. You want this kind of fish. This is going to be a healthier fish for you to eat.
Sea natural fish.
Natural.
They put also the farm in the sea, but they give
No, that's not natural.
Yeah.
That's not natural. Natural doesn't mean anything. If you go and buy food and it says natural, you know what that means? Nothing. It means nothing. Anybody can put natural on there. You want organic or free range. Okay? Or wild caught.
Also the food, if you eat, you have to eat a little, not too much. If I eat too much, by natural, I get sick also.
Or you're saying eating too much meat?
Yeah, too much.
I tell people, look, if you eat meat once a day, and then for your other meals, you can have eggs or fish or nuts or cheese, another type of protein.
Just
But
change.
yes, but talking about chicken or beef or mutton or seafood, I'd say you can have like once a day. And then the other meals you can have fish or eggs, and that's fine. Yeah.
Thank you.
Excuse me, madam.
Yeah.
These rotten egg poisonous?
Are rotten eggs poisonous? I have no idea. I've never eaten a rotten egg. I know there's a lot of people that eat rotten eggs. I don't know. I can't answer that. Dr. Ron, what's your view on rotten eggs?
Well, I think it's toxic because it's rotten already.
He's saying no. He's saying it's toxic because it's already rotten. So you shouldn't eat it.
Yeah.
Okay. Okay, everybody, shh.
Okay, about the diet behavior, especially in the Emirate. Most of the workers, they eat in the night.
Yes.
They eat very heavy food.
Yes.
And what advice do you like to give us? And the body, how much calories can the body a day it takes? Because sometimes, okay, I used to, read, she said the body needs between 600 to 800 calories every day. You can eat different type of food, healthy ones, but you have to control the calories. Let's say the body needs 600. If you take more than 600 or 800, whatever, I don't know exactly, it makes fat to your body, and that is very bad to your health. And this,
Yes.
Night diet.
Yes.
Is it okay or is not? It's bad.
Well, okay, so when we're talking about calories is a very outdated form of thinking because not all calories are created equal. If you are eating a healthy diet and avoiding sugar, avoiding bad fats, avoiding a lot of rice and bread, you don't need to worry about your calories. Because if you're just eating meats, good healthy meats and good vegetables and good fats, you don't really have to count your calories. But if that's when calories really come into play, when you're eating a bunch of junk, okay? So, but during the nighttime, yeah, you really, really want to not eat during nighttime because that's the time that your body is resting. So are you talking about people who are working at night?
Yeah, they work and they close from work, go to see them in the restaurant, they are taking their dinner.
Oh, dinner late, yeah. So we got to be careful about that because that can have a huge effect on the body. Your body cannot digest when it's sleeping. So you need to try to eat earlier. You really have to make your schedule. I know you have to do it around work, but you also need to do it around eating earlier because it's not very healthy to eat at night. Your body needs to rest at night. So you may want to for those people, they may want to try intermittent fasting, which is you don't eat anything after 6 o'clock, and then you wait till the next day, and then the next day about 10, 11 o'clock, you can start eating again. This is a lot healthier. But yeah, eating at night late is very not good for the body at all. The body cannot do what it needs to do at night, which is heal and recuperate. Okay.
What kind of vegetables would you prefer to include in our diet for a better human immune system? To
increase the immune system? Well, all vegetables are good, but you need to eat a lot of green. Green, 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 green. I can't stress that enough. Green. Greens as in leafy greens. The leafy greens have all the vitamins and minerals that we need. Okay, you get a lot of calcium from your greens. You get a lot of the B vitamins from your greens, a lot of magnesium from your greens. Okay, every day you should be eating some greens. Green leafy, spinach, drumstick, kale, romaine lettuce, lettuces, okay? Green stuff, chard, collard greens. You need to get the greens in your body every single day. If you don't eat anything green, your body's going to cry.
To lower the BP normal is 120 over 80.
Yes.
To lower the BP is by doing exercise.
Yes.
And to maintain the BP is by avoiding the bad fats.
That's one way. High blood pressure usually comes from inflammation in the blood vessels. So, what's causing inflammation? We'll talk about that in the next section. Bad diets, full of sugar, full of bad fats, this kind of stuff. So yeah, if you want to decrease your blood pressure, number one, decrease the sugar, stop eating the sugar and the bad fats.
Okay.
And then number two, you want to eat a lot of green vegetables every day.
Yeah. Now I'm talking because some of the people are don't have time for exercise, or else other people do not want to spend more time for exercise.
Okay.
So, if some people are eating green vegetables, and avoid bad fat in order to maintain the BP, is there a need for them to have exercise?
Exercise is very, very important. Exercise is very important. You don't have to do much. You can take 10 minutes doing some stretching on the floor, doing some squatting, doing some push-ups. Exercise, it's not like you have to go to the gym and work out for an hour. You can just do half an hour of walking around the building. But the body needs to move. The most important part of health is, number one, diet. Diet is the most important part. Okay? You must have good diet. If you don't have a good diet, no amount of exercise that you do is going to make up for that. Okay? So we say diet is about 80%, exercise is about 20%. So there are people who don't exercise much but still get in some movement during the day because they don't have time, and if they're eating a healthy diet, they're at least doing 80% of it. Okay? But if you're not eating healthy and you're not exercising, you're in big trouble. But yeah, but I do recommend getting in some kind of exercise, even if it's 5 to 10 minutes of sitting on your floor doing some exercise. Or walking. And you don't have time, walk to places. Park really far, walk to your car, go up and down the stairs during the day. Do things to get the body moving. If you're doing things all day that's moving your body, you don't necessarily have to go exercise for half an hour to an hour. You see what I'm saying? Yeah. If you're moving your body all day. If you're sitting in a chair all day like this, you need to exercise. You have got to exercise. You've got to be moving. So now we're talking about the immune system. What is immunity? What is immunity? What does that mean? Resistance to disease? To fight the disease, right? Right. So immunity, yeah, this is our immune system. This is all about, yes, fighting disease, fighting the bugs and the virus and the parasites and the fungus that tries to get in the body and cause disease. Okay, so the immune system is also known as the lymph system. Okay, it's also known as the lymph system. Lymph, you know this word? Can you get me another marker? This one sucks. Lymph. Okay, the lymph system. So what do you notice about this one? Do you notice anything about where these go? What system is this similar to? Kind of, but more similar to the circulatory system, the one we just learned, right? Why? The reason for this is this follows the circulatory system. The reason is because this is going to get the waste out of the blood. It's going to pull that waste out of the blood. If you look at blood, if we cut ourselves and blood comes out, what color is it? Red. It's red. And if if we squeeze something and lymph comes out, you know what color it is?
Yellowish.
It's clear, white. It's usually white, clear. If it's yellowish, it's fighting an infection. That's the lymph system fighting an infection. So yeah, when it's cloudy and yellow, it's killing bacteria and stuff. But, sorry? I thought somebody said something. Okay, so the lymph system. Here it is, lymph. Okay, so the immune system or the lymph system is including the white blood cells, the thymus. Who knows where the thymus is? Anybody know where the thymus is? Okay, the thymus is an organ that makes white blood cells. You think that's important? Yes. Yes, okay. So everybody take their hand and make a fist. And then do like this. Beat right there. What are you doing? You're stimulating your immune system. Oh, yeah. This is why the gorillas and the apes do like this, right? Ah, they're stimulating their immune system. This is where your thymus is right behind this bone. Yep. And so as we get older, it starts to shrink and doesn't make as many white blood cells. Is that a good thing or a bad thing? Yeah, that sucks because we want a lot of white blood cells, right? Yeah. So every morning you wake up, stimulate your immune system, yeah? That's one way. Okay. Then we also have the lymph nodes. What are lymph nodes? These are places where they're going to have a big concentration of white blood cells to attack anything. So, you know when you get sick and you get sore throat or you get a cold or virus, what happens? What happens here? These get swollen, right? These are big lymph nodes. Okay, so we've got lymph nodes all throughout the body. We've got them down the neck, in the armpit, in the groin area. These lymph nodes, you should not be able to feel most of them. You should not be able to feel them. If one of them gets infected and it's hard and you feel it, okay, we have a problem. Okay? But you really shouldn't be able to feel most of the lymph nodes. Okay? Then you also have your lymph channels, and then you have your spleen. What is the spleen? The spleen is another organ we don't hear much about. You know how I said the liver is on the right side? The spleen is on your left. Okay, here it is. This is look, here's the liver, and then here's the spleen. Okay, so the spleen is basically, it houses a lot of white blood cells, and a lot of blood goes through there. Okay, the spleen, you can actually live without your spleen. If you get in trouble and you get in an accident and your spleen is ruptured, you can get the spleen taken out and you can still live. Okay? No problem. No problem. But if you get in trouble and your liver is gone and you don't have a liver, now we got a problem, right? Okay, so that's the immune system. Okay, so the white blood cells. The white blood cells, it's their job to get the bad guys and kill them and take them out. Okay? It's also their job to remove any waste. Any waste in the body they need to get out. So, if your lymph system isn't moving very well, do you think you'll be getting out a lot of waste? No. No, you won't be. So this is an important concept. We need to understand the lymph system needs to be circulating like the blood. It needs to be circulating really good. It also needs to be cleaned out. We need to be cleaning out. A lot of people have very sluggish lymph systems that are full of toxins. Okay? And one way to clean them out is going to be water. Lots of water, guys. Lots of water. Water helps clean out the lymph system. Okay. So, all right. So now we're going to talk a little bit about inflammation. And I think you've heard me kind of throwing this word around, right? Because this is a very, very important word. Okay, it's a very important concept that happens in the body. So, what is this word? Flame. What is a flame? Fire. So this means to become like a fire, right? Inflame. Become inflamed. Okay? Inflammation is the body's way of healing itself. Okay? Inflammation is very important. This is how the body heals. If the body does not have inflammation, it will not heal. Okay? So, the 4 cardinal signs of inflammation will be redness, heat, swelling, and pain. Okay? So, let's take, if you sprain your ankle, right? You're walking and then you fall and you sprain your ankle. What's going to happen to your ankle? It's going to swell. It'll be very painful. It will look red. It will be colored. It will turn actually red and purple. Yeah? And then it will actually be hot. It'll be a lot hotter than the rest of your body. Okay? Is this a good thing or bad thing? It's a good thing. If this didn't happen, the body wouldn't heal itself, right? So this is a good thing. Okay? So we have inflammation comes in if we have a trauma or something happens. The body has redness, heat, pain, and swelling. And then this allows for the body to heal. So why do you think you have redness, pain, heat, and swelling? Why? What is it from? It's from an increase of blood to the area. Okay? What does the blood have? What do we have in the blood? The red blood cells carrying oxygen. We need to bring the oxygen for healing. And the white blood cells to kill stuff, right? Okay, let me give you another example. What's your name? Lindy. Lindy. So say we take Lindy and we cut Lindy's arm with a knife. What's going to happen to the area? Yes, it will start swelling and it will be painful, right? And the area will turn red, right? And it'll be a little bit hotter than the rest of the area. Why?
Because the body is trying to heal itself.
The body is sending all the blood to that area to heal it. Everybody with me? Yes. You're sending all the blood to that area, so it causes the swelling. And it causes the heat and the redness. Okay? That is inflammation. Okay? So, this is a very good thing. Okay? Now, there's 2 different types of inflammation. Okay? One of them is short-term inflammation. What we've just been talking about is short-term inflammation. This is very good because it allows the body to heal, right? The second kind is called long-term. This is inflammation that lasts for a long, 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 long time. Do you think that's good or bad? That is bad. We don't want our bodies to be in a constant state of trying to heal for long term because it can never heal. It's like somebody who keeps pushing a button and they keep pushing it and pushing it and pushing it and pushing it. What's going to happen to that button? It's going to break. Okay? So, let's get back. So, short-term inflammation. So, let's go. What happens when you have a cold? What happens when you have a cold or virus? You catch a cold. You become very hot. You have fever. What else? You get a lot of body pain. What else? You get headache. Your nose swells up. You can't talk like this because your nose swollen. Your nose turns red. Your throat swells up. This is all inflammation. Short-term inflammation. Is this a good thing or a bad thing? This is a good thing. Okay, so if this is a good thing, why is the first thing that people do when they get a cold, what do they take? They take medicine. And what does the medicine do? It stops the inflammation. Does everybody understand that? What does your cold medicine do? It's anti-inflammatory. It stops the inflammation. Do you think that's a good thing or a bad thing? That is bad. That is bad. Your body, we said this is the way your body heals. If you stop the inflammation, if you stop your body healing, that's not good. So what happens when people take cold medicine? They're prolonging their sickness. You understand? When you're sick and you have a cold and you take some Tylenol or some, what do you call it here? Some Panadol to bring your fever down and for the pain. Now you're making your sickness longer. Because your body, this is the body's way of healing. Even though it doesn't feel very good, we need to go through it. Okay, guys? So, short-term inflammation, good. Do we want to stop it? No. Long-term inflammation, bad. Do we want to stop it? Yes. Okay, go to the next slide. So, showing you again. Short-term inflammation, good inflammation. This is when you have something that happens short-term, like a broken ankle, a cold or flu, when you hurt yourself, when you break a bone. This is all short-term inflammation. So you have a stimulus, and then you end up healing. This is excellent. We don't want to really fight this too much, okay? Now, long-term inflammation, bad. This is when you have a constant stimulus. It keeps going and going and going, and something keeps stimulating the body to want to heal it. Long-term inflammation, we can't really see it too much with our eyes. It's usually on a cellular level. Remember we talked about the cells? We cannot see the cells with our eyes. What do we need? We need a microscope. So this kind of inflammation is usually on the level of the cell. When we have this much inflammation, this is the basis for all disease. I want to say that one more time. Chronic inflammation is the basis for all disease. Every disease out there is usually caused first by long-term inflammation. Okay? So remember we talked about cholesterol, high cholesterol. What does that come from? Inflammation in the liver. Okay, high blood pressure. High blood pressure comes from inflammation in your blood vessels. Okay, this all comes from inflammation. Okay, all your disease, cardiac disease, heart disease, diabetes, all these kind of things all first have chronic inflammation. So, what causes this? Look here. Okay, so this is the acute inflammation. This is all short trauma. Okay, and you're going to heal. Long-term inflammation, what do you get? Cancer, Alzheimer's disease, autoimmune disease, rheumatoid arthritis, cardiovascular disease. If a person doesn't have inflammation, will they get heart disease? No. If a person doesn't have inflammation in the body, are they going to get cancer? No. Okay? So, what do we want to do? We want to make sure we're not having chronic inflammation. So, if chronic inflammation happens at the level of the cell and I can't see it, how do I know I have it? How do I know when you come into my office and you say, "Doc, blah, 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 blah," and I say, "You have inflammation"? How do I know?
Because you see
The skin, I think, they change color, something like this.
What's that called? Symptoms. I can tell from your symptoms. If you come in and you tell me your symptoms, I'll say, you have inflammation. We cannot see it with the eyes, but we know when people are telling us they have all these symptoms. If you don't have any inflammation, you're not going to have any problems. You'll be very healthy. You'll be feeling good. You have great energy, sleep well, eat well, good appetite. no problems. People who have inflammation, they get lots of headaches. They're tired all the time, very low energy. They'll have rashes. They'll have a lot of gut issues. There's a lot of different symptoms you can get from chronic inflammation. Okay? Okay, so the next slide. Okay, so what causes inflammation? What are we doing to ourselves that's triggering inflammation every single day? What are we doing to ourselves that is causing this chronic inflammation? Remember we said chronic inflammation has a stimulus, it's getting stimulated every day. What's pushing that button? What's pushing the button? Sorry? Your immune system is down. Okay, you're going to have a low immune system, but what is causing your immune system to be low? Yeah, bad diet. A diet high in sugar. Sugar is the #1 cause of inflammation and decreases your immune system. Okay, how many of you eat sugar every day? Hands up if you eat sugar every day. If you eat sugar every day, hands up. How many of you think you're causing inflammation every day? Every single one of you that has their hands up, right? Every single one of you is eating sugar. Every day you're causing inflammation. Okay? What else causes inflammation? Bad oils, bad fats, junk food, chemicals, all these chemicals that are in our food, causing MSG, aspartame, this is all causing inflammation, right? So, this is part of the reason why we don't want to eat this stuff. That's the first thing to do to increase your immune system and decrease the inflammation. Stop eating a bad diet. Stop eating all this junk food. Stop eating out at KFC and McDonald's and all these places. Okay? So, what else causes inflammation? Chemicals, toxins. Toxins and chemicals in the environment. Where do we get toxins and chemicals from? Air pollution. Where else? All the car exhaust from the engines. Where else are you getting toxins and chemicals? Cleaners. Who uses cleaners? Clorox, Dettol. Yeah, you're smelling that all day. What about perfume? Yes. Who wears perfume? That's nothing but poisonous chemical. Who drinks water from a plastic water bottle?
Oh, it's only for one time.
This is poisonous. This is poisonous. How many of you heat plastic in the microwave? Nobody? You plastic. How many of you use plastic bowls in the microwave?
They mention on the plastic it's using.
Yeah, they say that's not really safe. Guys, when plastic gets heated, it's leaching these cancer-causing chemicals into your food and drink. Okay? Where did these come from?
Petroleum?
Okay, no, but once they're made, where do they keep these? In a warehouse, then in a hot warehouse in the heat, then they put them on a hot truck, and they deliver them, and then the store owner keeps it in a box in the storage, which is usually hot.
Actually, we don't know where they store this.
You don't know.
Yeah, nobody knows.
So we don't know. So people go to the store and they're cold and they say, oh, this is fine. Really, is it?
Where it was.
We don't know where it was before. Does everybody understand me? You need to cut down on using plastic. This stuff causes cancer. It's very bad for you. Okay? So, but this is what I'm saying. You're getting chemicals from everything in our environment. We're getting bombarded with all these chemicals. And this is decreasing our immune system. If the immune system and the white blood cells are so busy fighting off the chemicals, they're not going to have time to fight off the bacteria and the virus that we come into contact with. Okay? This stuff is decreasing our immune system and it's making us very weak. People who have a low immune system, they get sick very often. They have a hard time. It takes them a long time to recuperate from being sick. You know some people who get sick and they're sick for like 3, 4, 5 weeks? Or they're sick, they get a little better, they get sick again, they get a little better, they get sick again. It keeps coming back. We need to have a strong immune system to fight off these bugs, guys. Okay, also, what causes low immune system and what causes high inflammation? Stress. How many of you get stressed? Oh, we all stressed. Okay, so what I want to show you guys, you know, and I know some people who eat a healthy diet. They never eat any sugar. They never eat any bad oils. They eat very healthy and they exercise all the time. And then they end up with cancer. And then you say, how did you get cancer? You're so healthy. And then you sit and you talk to them and they will talk about how stressed they've been their whole life. And they don't know how to deal with their stress properly. Stress can kill you. You can do all the good, healthy eating and exercising you want. If you stay always stressed out all the time, this will cause disease in you. Okay, so what I want you to understand is these things, all these things we're doing all of this on a daily basis. And all of these things are causing chronic inflammation in everyone's body. So most of you doing this every day, you have high inflammation. So if I want to prevent disease, what do I need to do? I need to strengthen my immune system and decrease inflammation, right? I want to decrease long-term inflammation, not short-term, long-term. How can we decrease our long-term inflammation? What can we do? Eat a proper diet. How many vegetables? 5 to 9 servings. How big is a serving? I forgot to ask you, how big is a serving? He says it's like this. Is this a serving? Like this? Is this a serving? No. A serving is a handful, small handful. So it'd be about 3/4 of a cup. 3/4 of a cup. That's not that big.
What about 1 cucumber and 1 carrot? Yes.
Well, how big is it? Is it a small carrot or a big carrot? Okay, so that would be about 1 serving. Okay, so how many do we need a day? 5 to 9. If you have 2 servings with every meal, breakfast, lunch, and dinner, that's 6. That's 6 all day. Okay, so, what else can we do to increase our immune system and decrease the inflammation? Exercise. Exercise. Every system is directly affected by exercise. You see how important that is to us? What else can we do to decrease our inflammation? Decrease sugar. What else? Relieving stress. Learning how to deal with our stress. Learning how to relax. Okay? All right, these are all great ways. There's a lot more for decreasing the inflammation, and we'll talk more about that in the next few sections. Okay, so any questions about the immune system? Any questions about the immune system? Okay, so now we're back. We're going to get started with the respiratory system. Okay? So, go ahead. The respiratory system, this is what it looks like. What are we trying to do with the respiratory system? Anybody know?
Supply of oxygen.
We're trying to get oxygen to the body, right? That's exactly what we're doing from the respiratory system. We're getting oxygen. We're doing a gas exchange. We're going to give off carbon dioxide and take on oxygen. Okay, so what you have here, you have your nose, your nasopharynx, the trachea, and the lungs. This is all in the respiratory system. So the air comes through, comes down in here, And then go to the next one. And then comes through all these little branches, okay, in the lungs. And then we'll show you the end is where we have the gas exchange. But it's all about what we said, inspiration, inhaling, taking in oxygen, and exhaling, letting off carbon dioxide. Everybody take your hand and breathe on it. What do you feel? You feel, wait, what? Bad breath. You feel bad breath? No, you smell bad breath. Yeah. No, my breath is, mine tastes like, it smells like candy. No, what do you feel on your hand? Hot.
Like a steam.
And?
Steam. Like
Steam. What's in steam? It's wet. It's wet. So when we're breathing out, when we're exhaling, we're also getting rid of waste. Okay? Because you're having this water come out. Have you ever known someone who drinks a lot of alcohol and the next day they're breathing and every time they breathe you smell alcohol? It's like, you know? Because this is another way of getting waste out the body through the breath. Okay? So you're taking in and you're also getting waste out when you're getting out your carbon dioxide. Okay? Okay. So when you come, like I told you, the air comes all the way down, and at the end of all these branches are these little sacs. Okay? You need to know this name. It's called alveoli. You see that one? Yeah. Okay. You need to know this name because you will see this again. Hint, hint, you will see this again. Okay? Alveoli. What is this? These are the air sacs. If you can't see, it's up here. Right here. Alveoli. These are the air sacs where the gas exchange takes place. Okay, what do I mean by gas exchange? You're going to have the blood coming in. You see the ones covered in these little red and blue blood vessels? You've got the blood, the blue blood that has no oxygen. It's coming in. It's going to grab the oxygen from the air and give off carbon dioxide and waste.
exchanger.
It's a gas exchange. Exactly. It's an exchanger. It's giving carbon dioxide for oxygen. And it happens here in these alveoli, these little air bubble, these air sacs, and that's why they're covered in these blood vessels. So remember we talked about the heart, it sends the blood to the lungs to pick up the oxygen. Okay, so the only problem though is with this, when you breathe in through your nose, where is everything going directly into? Okay, but where is it going into? Blood. Into the blood. This is why you get, it's very poisonous when you're breathing stuff. Like H2S, right? You breathe in the H2S, it goes straight into the blood and then to the brain. There's not a lot of protective mechanism here. Okay, you are gonna have white blood cells and stuff like that, but it's not a great protective layer here. So whatever you're breathing, when you smell something that smells bad and burns you, guess where it's going? No, it's going right into the blood. It's going into the blood, straight into the blood. So that's why, you know, people, they smell diesel, petrol when they go to the gas station. I feel really bad for those guys who have to pump gas all day. They're sitting there smelling that, okay? So you need to be careful with what you're taking in through your nose. Okay, yeah, next one. So what kind of things damage the lungs? Anything we're breathing in, right? Anything we're breathing in. So the air pollution, the car exhaust, all this stuff in the air, okay? And when you're going around chemicals, when you're working around chemicals. Also, any kind of the chemicals you're cleaning your house with, okay? How many people have smelled Clorox? Clorox, you smell it? So would you put your nose up to a thing and go? No, you wouldn't, because it would burn you, right? You gotta be careful, guys. Okay, what about smoking? Where's smoking going? When you're smoking a cigarette, where's it going? into the blood. And then it crosses the blood-brain barrier, remember? Okay, so shisha. Who smokes shisha? None of you? Nobody here smokes shisha. This stuff is very bad for you also, okay? Things that you're breathing in.
The people, they smoke shisha, sorry. They say the shisha is better than the cigarette.
They lie. They lie. Don't believe that. Also,
Smoker or
also, what if when you get on the elevator and there's a lady with all this perfume, and you're like, I can't breathe. It's very poisonous, this stuff. It's very poisonous, okay? So what can we do to keep our lungs strong and healthy? What can we do? Exercise, number one. Well, number two, stop smoking, right? Stop smoking and exercise. Exercise is going to do what? It expands your lungs. It increases the oxygen uptake. You want more oxygen? Go out and exercise. Okay? What else can we do to strengthen our lungs?
Avoid smoke.
Avoid smoke. Exercise. What else?
avoid the chemical.
Avoid cleaners. Avoid chemicals. What cleaner can you use in place of all your household cleaners that cleans everything and kills all the germs? And is very cheap. You don't need a mask. It's cheaper than cleaners, and it kills more bacteria and germs than cleaners do. No, sanitizer is a chemical. It's not a chemical. Vinegar! Vinegar, guys. You want to clean your house? Vinegar will clean your house better than anything, and you will pay a lot less for it. And you can sit there and smell it. It's not going to hurt you.
It can remove also the plastic.
You got to mix it with baking soda. Yeah, okay? So this is a great way to clean the house without getting exposure to these chemicals that are hurting your lungs. Okay? Okay, any questions about keeping the lungs healthy? Okay, next one. All right, so now we're going to talk about the urinary system. Okay, go ahead. All right, so the urinary system, this is what it looks like, guys. These are our kidneys, okay? Then these are the ureters, the bladder, and the urethra. So what's happening here with the kidneys is filtering, right? It's removing the waste. It's producing urine. All right, so this urine is going to be taking a lot of waste from the body, and then in order to get it out. Okay, go ahead. So the kidneys, not only are they going to control some of the waste in the body, but they're also going to control the water levels in the body. Okay, so a lot of times when if you have high blood pressure, we'll always look at the kidneys first. Because if the kidneys are not working properly, if they're failing, it will cause consequences to your blood pressure. But the kidney's job is to balance the water, also with the salts, okay? And then, so you also need to know that a lot of medications that you take, you know, if you take medications from the doctor, this medication is a form of poison. It has to be taken out of the body, okay? So medication is either going to go through the liver or it's going to go through the kidneys. So if you're taking a medication and you take too much of it, it could damage these organs. Okay, so let's take Panadol. How many Panadol can you take without causing damage? How many can you take in one day? He says 3. 3? Only 3? 4. He says 4. Anybody know? How many Panadol can you take in 24 hours? How many? 6? I hear 6. How do we know? How do we know how many Panadol we can take?
Well, it's depends of the percentage of the paracetamol inside.
Sorry?
There is the percentage of the paracetamol inside. There's 600, there's 400, something like this.
Okay, depends on the milk. Okay, but how would you know? When you go buy Panadol, how do you know how many you can take?
They write 2. They have to take 2. Description.
It's written in on the label, in the box. It tells you. You don't have to be a genius. You turn the box over and it tells you, you can take up to 6 Panadol in 24 hours. Do you know how many people end up in the hospital because they took too many Panadol? Yeah. This is very common. Okay, what I'm trying to let you know, the Panadol does severe damage to the liver. If you don't know, make sure you read the package. Okay, you want to read the package and find out how much can I take, how much is going to be safe for me, because if you don't, you could end up in the hospital. Medications are not candy. They're not toys. You need to understand how many you can take, especially if you have children. Okay, guys? Because every medicine goes through either the kidneys or the liver. Okay? Now, when the liver has so much work to do, he's going to pull the kidney in and cause the kidney to do more work. Okay? And the kidney has to filter every single thing you drink except for clean water. If you drink tea, it has to filter it. If you drink coffee, it has to filter it. If you drink fruit juice, it has to filter it. Okay? What did we say at the beginning of this course? How much water do you need to drink during the day? Up to 2 liters. And were we talking about tea? No. Were we talking about juice? No. What were we talking about? Clean water. You got it? You need to drink clean water for the kidneys. If you're spending the whole day drinking soda and juice and coffee, you are putting a lot of work on your kidneys, and the kidneys are very delicate. Okay? Okay, so how do we keep our kidneys healthy? Water. Water! Lots of water. How else? Stop drinking alcohol. Yes, because the alcohol can affect the kidneys. It's worse on the liver, but can affect the kidneys. What else? Sorry? Avoid toxins. Yeah. How else can we keep the kidneys healthy?
Pepsi, Coke.
Stop drinking soda. Okay, what are we missing? Exercise. Come on, exercise. You got to exercise. It brings more blood to the kidneys. It helps those kidneys out, okay? All right. Okay, next system. Okay, any questions so far? Okay, guys, we're going to take a break. Okay, so we're going to talk about the musculoskeletal system. Okay, this is all about muscles and bones. Muscles and bones, right? Okay, so we have to have both of these especially for movement. Okay, you need to have your muscles and your bones for movement. They work together. Okay, go ahead. So the muscles are going to be the muscles specifically for movement. So the muscles, there's 2 kinds of muscles. There's ones that we can do on our own, right? I'm making this happen. And then there's other muscles that we don't have to sit there and think about. What was one muscle we talked about earlier? Heart. The heart. Do you have to sit there and go, okay, heart, beat. Okay, beat. Now beat. No, it does it on its own, right? We don't have to think about it. So the heart's going to do its own thing. That's an involuntary muscle, okay? It's going to work on its own. The other muscles I'm doing this on my own, okay? So
the other will give you order to work. This one is already...
It's already working, exactly. Okay, so the bones are really, they do serve several functions, but the big one is to protect All the organs. Remember we said the skull's protecting? The brain. What are the ribs protecting? The heart and the lungs, and a little bit of kidneys. The kidneys back there too. Okay, and if you notice, all of this is digestion stuff, right? There's not really a lot of bones here. Why? This isn't as vital as the heart and the lungs and the kidneys. Okay, so the thing with the bones, so you have what we call joints. Joints are where two bones come together, and at this part is where the muscles attach so it can move. This is a joint. Name me some joints. What's a joint? The knee joint. The ankle joint. The elbow joint. The finger joints. The neck. The spine. Everywhere in the spine is a joint, right? Hip joint, okay? So, what you need to understand about these joints is in between the bones, you're going to have a padding called cartilage. Okay, see it's showing you the padding, it's called cartilage. So you've got two bones that come together, and in between you've got this padding so they don't rub on each other. And then you have all the muscles attaching here, and that's how we move. Unfortunately, as we get older, this starts to wear away. Okay? As we get older, this cartilage starts to wear away, and the joints can get very painful. We end up, when we're older, we end up with arthritis, right? Arthritis, it's when you have like pain in your joints and you can't do stuff. So you need to take care of that. So you especially need to watch repetitive actions, right? Do you guys know baseball? Okay, so you have one guy who sits there pitching, the pitcher, yeah? He's doing this, how much is he doing this? He's doing this all day, right? He's doing the same action all day. How long do you think those pitcher's joints last? Their careers don't last very long because they're using the same joint over and over and over again. How many of you go to work and do the same action repetitively all day? Any of you? None? No one? Nobody? What do you do? Well, no, but I mean, like some people just hammering all day. Some people on the computer all day like this. No?
The mobile.
Everybody on the mobile like this. Yeah, we're all gonna break our thumbs. But this is the fastest way to hurt your joints, is doing a repetitive action over and over again. And Dr. Ron will talk more about that in the healthy lifestyle section. He'll talk about ergonomics and doing repetitive motions, okay? So, but we need to watch out because so many people when they're older have really bad pain in the joints. Go to the next one. So this is what happens, right? You have your normal joint. Here you got two bones. You got the cartilage in between. Good looking joint. All right, we've overused it. We've gotten older. The cartilage has worn away. It started rubbing on each other. Now it's swollen and red and painful. What do we call that? Swelling, redness, pain, heat, inflammation, right? Inflammation. Now we have inflammation here. Okay? So, you see that, guys? What do we say about inflammation? It's the basis for all disease. Okay? All disease has inflammation. Okay, so what can we do to take care of our joints and our muscles? What can we do to keep them strong and take care of them? Exercise! Yay! Y'all better have gotten that one. Okay, especially weight bearing. As a lot of women get older, especially women, some men, the bones get really brittle and break easily. Okay, we need weight bearing. Weight bearing, I mean like holding weight. Okay, that's why they go in the gym and they pump iron, right? They need weight to make those muscles and those bones strong. Okay, what else? Anything else? You need calcium. Calcium for the bones and for the muscles. Okay, and where do you get this calcium from? In healthy foods.
Yeah, from the sun. I think.
From the sun. We get vitamin D from the sun. From milk? From milk. Okay, how many of you drink milk? Y'all drink milk?
The milk comes from the any white. I think
Yes.
it's like.
Yes. So why do we need to drink milk? For calcium, huh? For calcium. Okay, let me ask you this. How many animal species drink milk past the gestation period? Gestation meaning that when you're a baby, when you're an infant, and you're drinking milk from the mother. How many animals drink milk in adulthood? How many animal species in the world? How many? 1, 0, 6. So there's one animal species that drinks milk in adulthood, and it is humans. We are the only animal species that continues to drink milk when we're in adulthood. Why? Why do we continue to drink milk? Because the doctors told us to. And the TV tells us to. And what did we say earlier? How much nutrition does a doctor get? 0. But your doctor says you should drink milk. And you drink milk? Okay, so a lot of us drink milk, and we don't even drink human milk, we drink cow milk. Are you a cow? Are you a cow? I'm not a cow. Are you a cow? Why are you drinking cow's milk? Why would we drink cow's milk? Do we have to drink milk? We just talked about no other animals drink milk. We don't need to drink milk. Let me tell you something. There's only 2 times in your life that your bones actually absorb calcium. And that is when you're a baby till in your teenage years. After in your teenage years, your body stops absorbing calcium in your bones. Okay? And then you don't start absorbing calcium again until you're in your later years, till you're older. So, how old are you? Your age? What's your age?
26.
He's 26. Do you think he needs to be drinking milk right now? He's not absorbing it. Okay? But even if you want to have calcium in your diet, is milk really the best source of calcium? No, it's not. Why do we think it is? Why do we think milk is the best source of calcium? Because the doctor says, and the marketing, they tell you on the TV, you need to be drinking milk. Look, we get a milk mustache, they tell you, you want a milk mustache? The dairy people were losing money. So they started a huge campaign to make sure everybody thinks you have to drink milk. Okay? Who remembers Popeye the Sailor Man? Did he drink milk to get strong? No, he ate spinach. He ate spinach. What did I tell you earlier was the most important vegetable to eat every day? Green leafy vegetables. Why? They're going to make you strong. It's going to make you strong. Yeah, Popeye did not drink milk. He ate spinach. Okay? Also, what was Popeye's girlfriend's name? Olive oil. Olive oil. See, they're subliminally telling you, eat spinach and have olive oil. Okay, so you guys, you don't need milk. If you want to give milk to your children, you can give them raw goat's milk. It's the closest milk to people milk. Okay, the closest kind is goat's milk. Okay? Okay, so, next one. Okay, so what do you need to eat for strong bones? Green, green, green. Yeah, think green. Spinach, broccoli, almonds, bok choy, flax seeds, kale, mustard greens, sesame seeds. This has a lot of calcium in it, okay? So if you want to eat some calcium, okay, guys. So, you want strong bones? You don't need to drink milk. Okay? Especially the cow's milk nowadays has been homogenized and pasteurized. It's so bad. It's causing, in little children, it's causing type 1 diabetes. Okay? If you want to drink milk, if you still feel like I have to drink milk, drink either the goat's milk, or if you're going to get cow's milk, you need to get organic cow's milk. And if you can get, there's some places that have it homogenized or not pasteurized or whatever. Okay? But the milk in the grocery store is not healthy for us. It's causing a lot of problems. Anything else about bones and muscles?
Regarding for this vegetable form, I think some people telling us it's because for uric acid. Too much uric acid.
Oh, they're saying these foods cause too much uric acid. Well, not all of them, but you don't need to be concerned with that unless you have gout. If you have gout, then you may need to watch out for these. But not all of these will cause that. But if you want more information, come and see me and Dr. Ron, and we'll help you, tell you what's got high uric acid, what to stay away from, what you don't need to stay away from. Okay? This is the last section, and then you will have a test. Joking, I'm joking. Your stomach's ready? Well, usually ready for some food at this point. We will give you food afterwards, I promise. We will feed you. Okay, so the digestive system. What is the point of the digestive system? What's the point? What have we been talking about all day? What are we trying to do? Extracting energy. We're trying to turn the food into energy. That's the whole point of the digestive system. Okay, so this is what it looks like, all right? It starts with the mouth. It has an opening in the mouth and goes all the way to the anus. Okay? So, and it's a hole. So it's not really inside of the body. Even though it looks inside the body, it's not technically inside the body. So, like say you have a child who swallows a diamond. What's going to happen to that diamond? Where does the diamond go? Stomach. It will come out the other end, right? Right. Because when we talk about digestion, the food has to be in a certain form that the body can take it in. The food must be in a certain form that the body can take it in. It cannot take a diamond into the body, right? If you swallow a diamond, it's not going into the body. It's coming out the other end. Okay? So that's what you need to understand. Digestion, the whole point of it is turning an apple into a form that it can absorb into the body, which is usually like a liquid form, yeah? Like a liquid. If you eat a piece of gum, if you swallow a piece of gum, where does it go? It comes out the other end. It's not in a form that the body can take up. So in digestion, we're trying to take an apple or a piece of pizza or a hamburger or broccoli or chicken and turn it into like liquid so that we can pull it into the body, the nutrients and stuff. Okay? Everybody with me? Yes. You guys with me? You guys back there with me? All right, great. Okay, next one. So, digestion will start in the mouth. It includes the mouth, the esophagus, the stomach, the small intestines, the large intestines, the pancreas, the liver, the gallbladder, and the rectum anus. Okay? So, it mostly starts in the mouth. Okay? So you take a piece of food, you take a bite, and what you're going to start doing is chewing. You start chewing because that's how we start breaking down the food, right? So we start chewing, and so we're having mechanical breakdown. And then we start releasing what we call saliva, right? Saliva starts to get released. Why? Saliva has a chemical in it that helps break down the food. And that is called enzymes or enzymes. You know this word? This is a very important word, enzymes. This is going to help the food break down chemically. Okay? So, you're eating the food in the mouth, you're chewing it, it's breaking down with the saliva. And then what we do, we get it into more of a liquid form. It won't be totally liquid, but we get it into that form, and then we're going to swallow it. And now it travels down the esophagus and goes into the stomach. Okay? Now, the job of the stomach is to continue what the mouth was doing. It's going to, mechanically, it's going to kind of squish it, and it's also going to chemically break it down into liquid. Okay, so, do you know if you go to the bathroom and you see some corn or some nuts in your feces, do you think you absorbed that? No. Do you think you digested it? No. Is it good? No. You should not see any food coming out. If you're seeing food coming out, you have a problem with your digestion. The stomach is going to turn this stuff into a liquid. Okay? The stomach has a very, very high acid content. Okay? Very high acid content. 2 reasons. Number 1, it needs to be able to digest your proteins. Okay, the proteins are very strong. They need to be broken down. Protein is like meat, right? Needs to be broken down. So in order to do that, you have a very high acid content which activates these enzymes to break down your protein. The second reason is it needs to be able to kill bacteria. Okay, so what's all over your food? Like if this was an apple and you take a bite, what's all over your food? Bacteria, germs, right? So the stomach has high acid content so it can kill most of those germs, right? Okay, so if you don't have high acid content, what happens? If the acid is too low, what do you think happens? The bacteria will not die. The bacteria will not die. So what happens is they hang out in the stomach and they produce gas. So what people get is they'll get bloated, you know, bloating. Their stomach will puff out and they'll feel like my food doesn't digest, it just sits there. Or they'll get burping, blah, blah, right? Because the gas is coming up. Okay? So has anybody had issues with acid reflux or heartburn? Heartburn, right? Where it's burning? Okay, it's burning. That is usually due to low stomach acid. Okay? Sometimes some people have a physical problem. Some people will have a hernia where the esophagus or part of the stomach is coming up. And then you have to fix that physically. But most other people who don't have a physical problem and have acid reflux, it usually is from low acid. It can also be due to smoking. If you're a smoker and you tend to have heartburn, you need to stop smoking. It can also be due to allergies. Yeah?
From the oil also. If the oil is too much, the food will be like this.
Everybody's different. I eat oil every day. I have no problem with oil. I have a problem with tomatoes.
Yeah.
If I eat tomatoes, I get heartburn. Okay? So guess what I did? Sorry? No. I'm going to drink Pepsi. Pepsi is very bad. What? No. No. Every time I eat tomatoes, I get burning. So what do you think I did?
Like a cucumber or something?
I stopped eating tomatoes.
That is the solution.
Really? I stopped eating tomatoes. Now I don't eat tomatoes. Guess what? I don't have burning. Okay? What do most people do when they have burning?
Water, yogurt, some
Or
medicine.
they take a pill.
Medicine, yeah.
They take a pill. What does the pill do?
It cools.
How does it cool it down?
No, it's adjusting the acidizing the...
It's decreasing the acid. The pills are called antacids. It means it's against the acid. It's bringing the acid down. Now, after what I told you, do you think that is a good thing or a bad thing? That's a bad thing. If you keep putting the acid down, you're not going to digest your proteins, and you're going to have a lot of bugs getting through. Okay? You do not want to take antacids. You want to find out the reason for the burning and fix the reason. If you take care of the reason, you won't have to take this medicine that causes more problems in the future. Okay? Everybody understand? You must have good acid in the stomach, okay? Okay, now, next part. So now the liquid from the stomach drops into these small intestines. Okay, so the small intestines is not built for acid. Okay, it's not built for acid. So what does it do? As soon as it drops into the small intestines, you see this hole right here? This is the small intestines. You have a hole, and down comes what we call bile. Bile, B-I-L-E, bile. Has anybody heard of bile? Bile. Okay? So it drops bile. Bile is made in the liver, the gallbladder stores it, and then the gallbladder drops it on the high acid food. When you drop the bile is very, very alkaline. So what happens now? You have high acid, the bile drops. It's going to make it more alkaline. So now it can pass normally through the rest of the colon and the rest of the intestines. Okay? What do you think will happen if you don't drop the bile? It will burn, right? So what happens? If it's burning, what do you end up getting? It's called diarrhea. You get diarrhea, right? And then it wants to come out really fast. It's saying, get me out, get me out, get me out. It's too much acid. You'll get inflammation. Yeah, it will cause inflammation, and you'll want to get it out as fast as possible. So you need to have these two things are huge to have good digestion. Number one, good acid in the stomach. Number two, bile drop. And this can become a problem if you don't have a gallbladder or if your liver's congested. So if you have these issues, you may have a problem dropping bile. So if someone is not dropping bile, they will end up with getting diarrhea often, and they will also end up with a lot of gas. Okay, those are the two things from somebody who doesn't drop bile. Okay, now the small intestines, the job of the small intestines is to absorb the nutrients. Right? We said our food is giving us nutrients. It's giving us sugar, proteins, fats. It's also giving us vitamins, minerals. The small intestine's job is to pull that into the body and absorb it. This is probably the third most important thing for digestion. In the intestines, we have bacteria. Now, when we're born, it's very good bacteria. We call it good because it helps us digest our food. The bacteria works with us, it lives in there, but it helps us by helping us digest the food. So these bacteria are very helpful, okay? But what happens is, in life, we start doing things that kill these bacteria off. And these bacteria start to die, and sometimes they get taken over by bad bacteria. So you get this growth of bacteria that shouldn't be in there, and then all the good bacteria are dead. And what happens is, when you get this overgrowth of bad bacteria in there, you will now not be able to digest your food properly. You're going to have major problems. And what where the science and the research is going in medicine right now is showing us this is one of the most important things going on right now. Probably about, I would say, 80 to 90% of people have too much bad bacteria taking over. And part of that is due to things like antibiotics. Do you know antibiotics? Antibiotic is a pill you take to kill a bacterial infection. Unfortunately, it kills all bacteria, not just, like if you have a sore throat and you take antibiotics, it doesn't just kill the bacteria here, it kills all the bacteria in the gut. And then what happens? Bad bacteria start growing in there. Okay, so we're finding this is a huge problem for a majority of the people. Okay, go to the next one. So, what is killing all these good bacteria? Bad diets, all the chemicals in our food, all this fast food we're eating, the soda, okay, all these chemicals, the plastic chemicals, okay? Also, the toxins in the water, meaning, okay, if you're not drinking clean water, so plastic, or you get fluoride, or if you're not drinking filtered water. Antibiotics, this is huge. We got to be very careful about when we take antibiotics. You should only take them in a life or death situation. Okay, because really, once you take antibiotics, you really kill everything in the gut. So also being sick, air pollution, stress. Stress is a huge killer of the bugs, okay? So what we need to do is we need to replenish these on a daily basis. How do we replenish these? By eating good bacteria. Every day you need to have this in your diet. Okay, so where do we get? You can get the good bacteria from what we call probiotics. Okay, look this word, probiotic. Okay, that is opposite antibiotic. The probiotic is going to give you good bacteria. You can take these in the capsule. If you go to Dr. Nutrition or any of the little health supplement stores here, you can buy a probiotic. It'll have like acidophilus in it, or bifidobacteria. It'll have stuff like that in it, and you can take that every day. Otherwise, you can eat fermented foods. How many of you normally grew up in a culture that eats a lot of fermented foods? Nobody? Really? You guys don't eat like pickles? Pickles? No? Okay. Yeah, a lot of people, okay, look. So, yogurt. Who eats yogurt? Yogurt. Come on, guys. Yogurt's fermented. If you're going to buy yogurt, you need to buy plain yogurt with live culture. If you buy yogurt that has added sugar and added fruit, that will kill the probiotics. It's useless. A good yogurt is like a good Greek yogurt. Very good. Okay? You need to be eating this stuff daily, guys. Okay? So we can have yogurt. What about sauerkraut? Y'all know this one? Sauerkraut? It's a pickle, it's a fermented cabbage. Yes, cabbage, fermented cabbage. These are other ones. Kombucha, you can get a beet one here. The other stuff you won't know, but you can ferment vegetables, and that's what the pickles are. A lot of the cultures grew up with fermented cucumbers, and they make pickles. You should be eating these foods every day or taking a capsule of probiotics. Very important for the gut. Okay? Okay, everybody with me so far? How many of you take this on a daily basis? Nobody. Yeah. This is very, very important. We got to get those good bacteria in the body, okay? Okay, next picture. Okay, because this is what happens. This is what we're seeing with most people when they come in. When I was in my private practice, I would say 80 to 90% of my patients coming in with digestive issues. Why? Everything we're doing is affecting the health of our intestines. So look, this one's showing you a person is eating very healthy and living a healthy lifestyle. This is the lining of the intestines is very healthy. But you take a person who's taking a lot of medication. They're eating a lot of Kentucky Fried Chicken. They're drinking a lot of soda every day. They're eating a lot of bad foods. They're not exercising. Okay, what's happening now? This is what happens to the lining of the gut. It's becoming very sick. It's becoming very, very sick. And I'm telling you, from private practice, 80 to 90% of my people have this problem. How do I know if you have this problem? If you come into my office, how do I know if you having this? Symptoms. Symptoms. People, they having a lot of burping, a lot of bloating. They're having constipation. They're having diarrhea. They're having a lot of gas. These kind of issues. They're seeing full food in the toilet. Okay? This is how we know. Okay? And then what do we call this? What's the name I gave you for this? Redness, heat, swelling, pain. Inflammation. This is what inflammation looks like, guys. This is inflammation in the small intestines. Go to the next one. So, we also call this leaky gut. See here? Leaky gut. Yeah? The reason why, okay, so let me show you. I'm going to draw this out so you can understand. Okay, so here you have okay, so this is the lining of the intestines. And now say you've just eaten a piece of pizza. Yeah? You just ate some pizza. So now the pizza's coming down. It's the job of these cells in the small intestines to pull in the nutrition. So the cells are like the guards, like the security guard, yeah? He's only going to let in who needs to be in here. He's not going to let in the bad people. So the same thing with the cells. The cell is only going to take what it needs. If it needs some vitamin A, it's going to pull in some vitamin A. If it needs some vitamin B, it's going to pull in some vitamin B. If it's a chemical or toxin doesn't want in, it will leave it. So it goes down and goes out. That's what the gut is supposed to do. Now what happens when you get inflammation in the gut, what happens now is you get, what do we say you get from inflammation? What are the 4 signs of inflammation? Redness, heat, swelling, and pain. Okay, at a cellular level. So what we see now is they get swollen. And now what happens is now there's gaps. It can everything can now leak through and get in without the security guard telling it. It would be like if you go right out here and there's that gate, if we open the gate, anything can come in. So this is what we call this leaky gut, yeah? So the food now, instead of the cells saying, oh, I want this, the bad stuff is now able to come through and get into the body. You guys with me? Everybody understand? So this look, here's another, okay, leaky gut. You will see this again. This is very important to understand, leaky gut. Why it's called leaky gut? In a healthy cells, nothing can get through, right? But in a leaky one, leaky gut, inflammation. Now everything can come through the cracks. All right, and the more we study this, the more we're seeing that this is true. And what's causing this? All the junk in our diet, all the toxins, stress. Look up here, right? Stress, antibiotics, infections, too much junk in the diet. All this is causing leaky gut. How do I know if you have it? Symptoms. Symptoms. So, if you have no burping, no bloating, no gas, you go to the bathroom, and you're very healthy, then you probably don't have this issue. Okay, so now the food has been in the small intestines. Now it gets dropped into the large intestines. Job of the large intestines is to absorb the water and put it into a form where we can take out the waste. Okay? So, now we're talking about the large intestines. How many times do you think is healthy to go to the toilet every day to pass a bowel movement? Once. I got it once. Anybody else? 3. He says 3 times. Everybody laughs at you. Everybody laughs. Why does everybody laugh? Why does everybody laugh when he says 3? He's saying you go 1 time every day. You don't need to go 3 times. What about once every 2 days? That's bad? That's bad. What about once a week? That's bad? What about 5 times a day? Too much?
You have to go to the doctor.
Okay. A healthy person normally goes to the toilet 3 times a day. What does this mean? Most of you are not healthy. That's what this means. You eating 3 times a day, you're going to go to the toilet 3 times a day. Most people, most healthy people, 10 minutes after they eat, they go to the toilet. 1 time a day means you have constipation. Okay, is this healthy? No. Is it normal? Yes, it's normal. Is normal healthy? No. This is what your doctor tells you. When you go to the doctor, you say, "Doc, I only go to the toilet once a day. Something's wrong with me." He says, "It's normal." Yeah, because everybody else is eating a crappy diet and they also cannot go to the toilet. That's normal. Okay? We live in a world, we're getting full of all these toxins, we're eating bad foods. A lot of people cannot go to the bathroom. We need to go to the bathroom. I'll take 2 times, but 3 times means you're in really good health. Okay? So, what can we do to make sure we're going to the bathroom 3 times a day? What can we do? Eat healthy foods. What's healthy foods? Fibers. We need lots of fiber. Where do we get fiber from? Vegetables. Yeah, you can get a little bit from beans and legumes, a little bit from grains. We get most of the fiber from our vegetables. Okay? So if these guys are only going once a day, they're going to eat more vegetables. What else? What else can they do?
We are working desert.
Drink water. Increase your water. If you want to go to the toilet, drink more water. This is the first thing I ask people. You only go to the toilet once a day. How much water are you drinking? Usually they're like, 1, 2 glasses. Okay, increase the water. The water is going to push that out. Okay, if you're too dry, not enough water, only once a day. So you're not going to go to the toilet right after you eat it. That's really fast. That's really, really fast. But yeah, no, what you're dumping today is food you ate yesterday usually. Some people are slower, some people are faster. Okay, so what else can we take besides fiber and water? What else can we do or take to increase how many times we go to the toilet? Exercise! Guys, exercise! You need to move, yeah? If you don't move, you're not going to move it out. All right? If you have a problem going every single day, or if you can't go in one day, you know those little trampolines, the mini trampoline? Yeah, you jump on it. You jump on the trampoline, jump for 7 minutes, you will go to the bathroom. Okay? It will come out.
It's food exercise.
Food exercise. So what else can we do? What's number 4? What's the 4th thing we can do to increase our bowel movements? Water. We already said water. Close. What's number 4? Okay, what do you do when the door won't open, it's stuck, the hinges are stuck? Lubrication, oil, guys. Remember at the beginning of the course we said I need to eat fat, right? I need to eat fats. I need to eat oils. The oils, if you increase your oils, it's going to help that move out. Okay? Specifically, flaxseed oil, fish oil, those are really good for helping move the intestines.
Like sesame oil, it's good also.
Sesame oil, don't heat it, for sure don't heat it. Okay. So, but flaxseed oil and fish oil, much better. Okay? So now, everybody's going to go to the toilet 3 times a day. Yeah? So that was the large intestines. The large intestines puts out the waste. So now I'm going to talk to you about the accessory organs. So one of the main, most important organs in the body we've already discussed is the liver. Okay, why is the liver so important? The liver is so important because how many functions did most of the organs we talk about have? One. How many functions does the liver have? 500. 500. 500. Yes, 500. Yes, this is amazing. The liver is amazing. The most important one, though, is filtering the blood. The liver filters the blood. Okay, it's cleaning our blood out, which is very, very important. The blood is our life force, right? So the liver is filtering it, but it also processes fats. It makes cholesterol. It makes blood clotting factors. It stores hormones.
The factory of giving the blood, right?
Yeah, it does all kinds of stuff. The liver has 500 functions. Go to the next slide. Listen, I don't expect you to know all 500 functions. For the test, if I ask you, is this a function of the liver? What do you say? Yes. Okay. So the liver pretty much does everything. So if I ask you, is this a function? You say, yes, the liver does this. The liver does everything. Okay. This is why it's such a problem if the liver's not working properly. If the liver's not working properly, you're going to have issues with 500 functions. Everybody with me? So this causes a huge problem for the liver. This causes a huge problem if we have problems in the liver. So where the liver comes in, being very important, go to the next one, is in detoxification, right? We talked about the liver is filtering the blood. It's taking the toxins out of the body. What is a toxin? It is unhealthy. A toxin is like a poison. It's something that comes in the body and does damage. That's a toxin. And it's the liver's job to get those out before it hurts us. What was one of the things we talked about earlier? Margarine, trans fat. Remember we talked about trans fat is like eating plastic. If the trans fat is staying in your body, it's causing damage. It's the liver's job to take the trans fat and get it out. But the liver has a really hard time with trans fat because trans fat likes to hide all over the body. Okay, but toxins can be anything. It can be chemicals. It can be stuff we're smelling, like perfume, cleaner. That's all toxins. It can be air pollution. It can be smoking. It can be alcohol. It can be the plastic from your water bottle. That's all toxins. So it's the liver's job to get all these toxins and then take them out of the body. So this is where the problem comes into, okay, with the liver. Because, let me tell you one thing, what they say is that how we're living now, in this day and age, we are coming into contact with more toxins and chemicals in the environment in one day than people who lived 100 years ago came into contact with in their entire lifetime. Let me say that one more time. We are coming into contact with more toxins in one day than people who lived 100 years ago came into contact with their entire life. That's huge. We are being bombarded by toxins every single day. So what is happening? This is what is happening, okay? So this is your liver, okay? So a healthy person, a person who lived 100 years ago who was healthy, they would get some toxins would come in, the liver would take them out. Okay, the toxins would come in, the liver would take them out. Great, liver was working great. Now, fast forward to our day and age, okay? We wake up, okay? So we wake up and the first thing we do is, the first thing we do is we drink some water that has fluoride in it, okay? And then we go take a shower with some shampoo, which is full of chemicals in it, and our soap is full of parabens in it. And then after the shower, we go and we're getting radiation and stuff from the Wi-Fi and the TV. We put the TV on. Then we get ready to go to work, and this guy smokes, so he's going to go have a cigarette before work. And then he's going to stop at Starbucks, and he's going to get a coffee that's full of sugar and full of a bunch of chemicals in there. So now he's going to have some Starbucks coffee, okay? And then he's going to go to work, and he's going to stop with his friends, have another cigarette, and then, oh, let me go drive to McDonald's, I need breakfast. So then he goes have a McDonald's, which is full of trans fat and other kinds of stuff, okay? Then he gets to work, and they're painting next door at work. So then he comes into contact with all this paint fumes, okay? And then he goes walk outside, he's getting all this air pollution. Okay, that's just the morning. That's not even the rest of the day, how many toxins we're coming into contact with. What's happening is now, the liver can still only get so much out. What is happening to all this? What's happening to all the chemicals in the body that the liver can't get out? It's causing damage to the body. Okay, it's causing damage. And then it's not only causing damage, it's causing the liver to go slow. Because the liver is having a hard, he's overworked. He's working too hard, he has too much work, he cannot get all this out. This is the problem. Okay, so what we're seeing is that most of these people are having this issue, the liver's overloaded and it's not working properly, and we have too many toxins in the body, and it's causing all kinds of issues. So what we tell people you need to do is detox the body. You need to detox the body. We try to do it at least once a year, if you can twice. What a detox is. In a detox, we stop the chemicals from coming in, we avoid all the chemicals, and we help the liver get the toxins out. So you can do water fasting, you can do juice cleansing, you can do just eating vegetables, and so there's all kinds of forms of detoxing. Ramadan can be a great detox for you, okay? If not, then you need to choose. It doesn't have to be a month long, it can be a week long. You can do juicing for a week. You can even do just eating just vegetables for 3 or 4 days. Or you can even do one day. You go 1 day a week and don't eat anything. Some people will fast 1 day out the week, that's it. Okay, so, but you need to do this. Everybody needs to detox. If you do not detox during your life, you're gonna have a hard time preventing disease and getting your body healthy. Because we're all coming into contact. There's nothing we can do about the air pollution. There's nothing we can do about that, okay? There's nothing we can do. You have all these friends who are smoking all the time around you. Sometimes there's nothing we can do about that. Try to avoid that. You know, there's nothing we can do about, we were talking earlier about fruits and vegetables being full of pesticides. There's not a lot we can do about that. We have to eat them, okay? But with the things you can do, I can choose not to drink out of a plastic bottle. I can choose not to smoke cigarettes. I can choose not to drink alcohol. There are a lot of things you can choose to not do and not get those toxins in. Okay, so the liver. This is what the liver looks like. This is a healthy liver. It's kind of spongy, right? It's kind of like a sponge. So when the liver gets really, really bad, you end up with what we call cirrhosis. Okay? But the first stage is called hepatitis. You know this word? Hepatitis. What does this mean? Inflammation of the liver. Hepatitis is inflammation of the liver. I'll tell you a trick. Anytime you see this word, itis, that means inflammation. Remember we said every disease starts off with inflammation. So, what do we say? We've got hepatitis, inflammation of the liver. Dermatitis, inflammation of the skin. Okay, iritis, inflammation of the iris. this, in the eye, okay? Everything, arthritis, inflammation of the joints. Everything will have an itis, okay? It means inflammation of the word before it. So, hepatitis, inflammation of the liver. Where do you get hepatitis from? You can get it from anything. Most people think of hepatitis as in virus, hepatitis A, hepatitis B, hepatitis C. Okay? Yeah, that is one way of getting it. Viruses can give it to you, but you can also get hepatitis inflammation from too much alcohol, too much medication, taking too much Panadol. Okay? Pretty much being overweight. You can be overweight and cause hepatitis. Who's heard of fatty liver? Fatty liver. Nobody? Nobody's heard?
I didn't make a check on many.
Okay, there's a thing called fatty liver, and this is very common, guys. Okay? Fatty liver. Fatty liver, it means the liver is so full of fat. It's so full of fat, it can't function properly. Okay? You get this from being overweight. Okay? I hate to tell you guys, but being overweight can be a huge problem. All right? You also get this from a lot of other things, but in this, you have fatty liver, usually means you're going to have diabetes. You're going to have sugar problems. Okay? So, anyway, hepatitis, first stage, inflammation of the liver, and then you end up with cirrhosis. Basically the spongy liver has become like rubber. Do you think it can do any of its 500 functions? No, it cannot. This is the end stages though. Okay, so that's the liver. Liver is very important. Okay, next, the gallbladder. Gallbladder is a small little organ that sits under the liver and drops bile. So it stores the bile and then drops the bile. That's it. Okay? Then we also have the pancreas. The pancreas is a very important organ. This is involved in sugar problems. Okay? But what we want to know about it is it also makes the enzymes. Okay? It makes the enzymes for us to help aid our digestion. Okay, next one. Okay, so enzymes, very important for digestion. As we get older, we stop making them so much. So a lot of people will take digestive enzymes in a capsule form, in supplement form, with their food. And this helps digest the food. So, you don't have to remember the names. These are just protease, lipase, amylase. These are different forms, like one's for fat, one's for protein. You don't have to remember the name. Okay. So we've been talking about inflammation, right? There's two kinds of inflammation. There's short-term and long-term. Is short-term good or bad? Good. Do we want to stop it? No. There's long-term inflammation. Is that good or bad? Bad. Do we want to stop it? Yes. Okay. So what's causing long-term inflammation? Margarine, sugar, fast food, gluten, which is in wheat, and meat, eggs, and dairy can contribute to inflammation. Okay? Now, how do we decrease it? Who's eating these things every day? Raise your hand. If you're eating one of these foods every day, one of those foods every day, all of us are stimulating inflammation in the body. Okay, so what do we do to fight that? We need to eat foods that are decreasing inflammation. What are those foods? Well, let's take a look. Who knows turmeric? Turmeric is the yellow that a lot of Indians put in their food, yeah? Curcumin. This is highly anti-inflammatory. This is excellent. We tell everybody who has high inflammation, we give them this in a capsule. And they can take a lot of this during the day. It helps bring down the inflammation. It helps bring down the inflammation in the liver. Okay? Turmeric is very good for you. What else? Cherries. What's this? Broccoli. pineapple. All of these are anti-inflammatory foods. Berries, strawberries, blueberries, raspberries, blackberries. These are so good. They're full of antioxidants for you. Helps bring down the inflammation. Nuts and seeds. Oh, onions and garlic, yeah? Avocado. And our favorite? Spinach. Guys, and these are just a few of them. You need to be eating most of these every day. If your diet is made up of 80% foods that decrease inflammation, then the foods that you do eat that increase inflammation is okay. It won't be causing a problem. But if your diet is 80% this stuff, we're having a big problem. And how many of you would say your diet right now is 80% this stuff? None of you? Oh, you're all healthy, right? Liars. Liars. You all lie. Okay, guys. This is the test. What can we do to decrease long-term inflammation? Go. Exercise, number one. Exercise, number one. What else? Fish oils, anti-inflammatory, bring down the inflammation. What else?
Drinking more water.
Drinking lots of water. How about decreasing your stress? Decrease your stress. Do stress-relieving exercises. Meditate. Sleeping. Sleeping is so healing to the body. Laughing. Okay? All these things are going to decrease the inflammation in the body. What about eating good fats?
Yes.
Okay. What about taking turmeric? Yes. Okay. So, we talked this enzymes. We talked about enzymes. If you take those away from food on an empty stomach, they will help you bring down inflammation. Fish oils, anti-inflammatory. Oh, what's this one? What is that one? What is that? Good bacteria. You should be eating these every day, guys. Where's this one? Where's this come from? Lemons, oranges, limes, yeah? Curcumin, we talked about exercise. Oh, what's this one? Sun exposure. Okay, sleeping, meditation. Okay, anti-inflammatory diet. Eat lots of fruits, vegetables, whole grains. Okay. So, this is what I will leave you with. Again, it's your choice. I cannot come to your house and put a gun to your head. You can choose to eat a bad diet, not exercise, smoke shisha, drink a bunch of alcohol, and live your life like that. Fine. But what will happen to you? You will have diseases and you will be in the hospital and you'll be taking medications for the rest of your life. Or you have the choice. You have the choice of, I choose not to drink alcohol. I choose not to smoke cigarettes. I choose not to eat McDonald's and Kentucky Fried Chicken, and I choose to eat healthy foods. How many vegetables do you need to have every day? How many servings? 5 to 9, yeah? I can choose to eat good fats. I can choose to exercise, even if it's only 10 minutes a day. And what happens then if you make good choices? You are going to be very healthy, and you're probably not going to end up with sugar problems and cancer and all these things that are debilitating people. Okay? The worst is not even it killing you. The worst is you got to live with it for 20 years with a horrible quality of life. Have you known people that can't get off the couch? Do you know people like that? Do you know people with blood sugar problems who've lost their legs? Do you want to live like that? I don't want to live like that. But this is what I'm saying. If you don't watch what you're doing, you could end up there. Close your books. Get a pen. We're going to pass out the tests. When taking the test, what I want you to do for the test, write your name and date. If you don't do that, you won't get credit. this is not a partner test. We do not take it with our friends. This is you only test, so you must be quiet. Okay? When you read the question, read every answer, because there may be more than one correct answer. So don't just read the first one and tick it. Tick the right answer. Okay, whatever answer you want, just tick it, and then we will grade your tests based on that.